get a good read at some of the interesting reports that's come our way. We'll just start, unless there's anything extraordinary that anybody wants to say. I just want to say I hope you're all keeping safe. I certainly, probably like most of you, look forward to us all meeting up in person as soon as possible, but it looks as though that's going to be later rather than sooner, unfortunately. So we'll just deal with things as they come. We're getting our reports out. We've had them out over the past week, and as you'll agree, some interesting and relevant reports to the ongoing situation and some retrospective for the services over the last year. So welcome along, and all we'll do is formally start by asking for any apologies. I know one that's in is my vice convener. So I believe Claire quickly has Claire, you've put in a substitute notification for that. Is that okay, Andrew? You've noted that?
Yep, and also an apology from Councillor Fannin has been notified to me, convener.
From Gillian,
An apology for Kevin Doherty. It's a hospital appointment.
Absolutely. We'll just note them. People can't always make it along, certainly under the present circumstances. Andrew, have we got all that noted?
Yes, I have, convener. And I also know that Councillor Catherine Johnson is trying to get on some issues at the moment.
Sorry, I'm staying off mute, by the way, but if you don't mind, if you'll know IT better than me, I'm staying off it for obvious reasons. Sorry, Andrew, you were explaining there.
So I was just saying that Councillor Catherine Johnson is trying to get on. She's having a few connection problems. So I've got Louise is talking to her to try and help her get on. Okay, and you can keep me right and notify me on that. I've got the bar down the side here. So that was
sorry, can I just interrupt just a wee second? Councillor Caroline Stevens is having problems. Oh, it looks like she's on. Right, that's fine. Sorry,
I thought I saw Caroline earlier. You're down.
Yeah,
Caroline, you're in my bottom left-hand box.
Yeah, she had no sound, so she was logging off to log back on again.
Yeah, Caroline, can you? No, Andrew, it looks as though there's a problem there with Caroline. Caroline?
A moment.
Okay, so if you could deal with Councillor Stevens' situation. You okay there, Andrew?
Councillor Stephen, you appear to be on the call. Can I just check that you can hear us?
Doesn't look like it.
No.
Well, Caroline, use the chat blocks, Andrew.
Yeah, I'll get someone to give Councillor Stephen a phone.
Good. If you could deal with that, we'll give it a minute just to see if we can get Caroline on. I don't want to be starting without anyone. Thanks for letting us know about that, Claire. And the show started with the tap dancers. No joy, Andrew?
I think it's probably going to take a few minutes because the officer's on dealing with another councillor trying to get on at the moment. So it's probably not going to be done in the next few minutes. Okay.
Well, with the agreement of the rest of you, the first report is the COVID update. And
so it can be declarations of interest first.
Oh, sorry, declaration of interest. Sorry, I put that much attention into the technology side there. If there are any declarations of interest, if I could take them first of all. Okay, that's a formality, that one, and it takes us on to the COVID update, which, as you'll know, is coming to all service committees, and this one is specifically for our committee service and our services, and how we have addressed the what do you call it, the problems that it has, and how we're actually managing to respond. No doubt subsequent reports, we know there's an umbrella, an overall overarching report coming to policy and strategy. I know those of you that are on housing tomorrow, you'll see a housing COVID update. So this is specifically for adult health and social care. It's an interesting report. And with that introduction, I'll hand over to Ross. If you're okay to take us through it, Ross. I know we've been through it in some detail already at the conveners meeting, but with all members here, I'm sure they're looking forward to you taking us through this interesting report. Thank you.
Okay, thanks, convener. As you know, this is a report that's outlining some of the response within adult health and social care. But for the council as a whole, we're bringing together a sort of conglomerate paper from all the different committees through policy and strategy that will bring together the whole response of council and partners for members. But just to run through really in terms of the information, obviously we had the command and control structure that was put in place both within health and social care, or for health and council, covering health and social care, and the health and social care partnership was a full participant in both command structures. And that gave us the opportunity to do quite a lot of coordination between health and social care and the wider local authority response, which was actually really helpful. In terms of numbers, as at the start of August there, you can see the number of cases was at 2,785. We're now over 3,000 in Lanarkshire. We've currently, as of this week, got 28 inpatients, still 0 in intensive care just now. But I think what you can see through the media is a sort of growing number of positive cases of COVID again, and I suppose a concern coming our way in terms of Lanarkshire that we may ourselves come towards further restrictions in terms of movement, etc., due to the increase in numbers. But a lot of work going on between the two local authorities and NHS Lanarkshire to try best to ward that off. One of the biggest challenges throughout COVID has obviously been around care homes, and one of the areas where we've had a really significant amount of local work, but also national direction. So I think we're at over 100 separate pieces of guidance issued out to the partnerships around the care homes. So it's been a really intense piece of work over the last few months. And the paper summarises some of those key responses. So we've got a care home assurance group that myself, Alison and Morag sit on, alongside Director of Nursing, etc., and public health colleagues to really try our best to coordinate and assure ourselves we've got the right responses across all the care homes. The team very quickly set up weekly conference calls with all the care home managers, which has been really well received and has given us that really good two-way flow of information between the care homes and our services. We've enhanced the social work quality assurance input. We've increased the input from care home liaison as well. So that provides additional nursing support into the care homes as required for training and other purposes. We've enhanced the health protection team within public health, again to support outbreak management and screening and testing of staff. We've got a weekly testing programme now. On a weekly basis, we're testing over 4,000 care home staff and have been doing that since the start of June. And we've also got increased input from infection prevention and control, and this is supporting both inspections and visits of the homes, as well as providing additional advice and support to each of the care homes. And we've also got some senior nursing leadership in place as well, so that we can provide additional input to care homes as and where required. In terms of other pieces, assessment centres were quite a big focus, and we set up 2 COVID assessment centres, one in Airdrie and one in Hamilton at the outset of this. And this was to try our best to save COVID cases either going directly to ED or through their GP practices. So it set up a hub, so anybody going through NHS 24 who was deemed to need to go this pathway would then be screened through to our hub. And that was staffed by senior clinicians who were able to speak to the individual and identify what to do next. So at the start of August, we had over 12,500 patients that had been triaged through to that hub. Of that, just about 4,300 had then been brought through to one of our assessment centres to be physically seen. And of those 4,900 odd patients had been hospitalised. But it shows you the numbers in terms of, starting up at 12,500 through to 900 patients hospitalised, the sort of impact that that's had, and trying our best to keep the hospitals as clear as possible. Similarly, in terms of mental health assessments, we also created mental health assessment areas in each of the 3 acute sites, so we could try our best to remove those patients into a more suitable environment out of ED during the peak pressures. And you can see there we've had over 1,300 patients seen through that pathway, and again, further work ongoing on that one in terms of what that could look like over the winter months as well. PPE was a really significant challenge. And again, one where we had frequently changing guidance at the start as we started to learn more and more about the virus. And we did quite a significant piece of work locally with great support from trade unions, I have to say, in terms of making sure we tried to keep our staff as safe as we possibly could. The joint equipment store played a really strong role in this for the whole of the social care sector, so that was both in-house and external providers as well. And there was decisions taken at the start of May to move us to Table 4 of the Health Protection Scotland guidance. This is taken to Public Health and NHS Lanarkshire for health staff, but we immediately rolled the same methodology out for social care staff. So this changed the need for staff to undertake an assessment, a risk assessment as to whether or not they should use PPE. It just made it stipulated that they should wear PPE if they couldn't maintain social distancing. So that came across for the whole of health and social care, hospitals and community all at the same time, which was, I think, a really positive way of working, and just made sure there was no hierarchy in terms of provision of PPE across the sectors. Early discharge was a huge challenge in terms of how do we support the hospitals. I think a really important decision that we took locally was that we wouldn't be discharging patients to care home unless their final destination would be to go to a care home. So we didn't use care homes for things like home support patients, etc. We only used the care home sector for those who would end up in a care home as a final destination. And I think on reflection, that was a positive decision, but also very much in line with the ethos that we've built up in North Lanarkshire. Staff testing has been something that's developed and is an ongoing development still. And we've seen with the impact of the schools, etc., coming on, that we've had a fivefold increase in the last couple of weeks in terms of demand for testing, which is starting to put a strain on both the UK government testing centres and NHS Lanarkshire testing centres. And picking up in terms of test, trace, isolate and support, I think this is a huge success between the different partners involved. So we had over 12,500 people in Lanarkshire on the shielding list. And from that work, so through North Lanarkshire Council and then linking in with public health partners, etc., we were able to provide a whole wide range of assistance. So you can see some of the figures, and I have to say the third sector in Van El played a huge role within this. We had over 1,000 community volunteers, 81 community organisations involved in the provision of this. But you can see some of the huge figures that are in there in terms of over 6,000 food packages, 830 meals being delivered a week, over 51,000 supported with shopping, etc. So you can see the impact that's had. We've also had 225 referrals through to financial inclusion, and you can see the scale of home support response over time as well, with nearly 700,000 visits over that time period. So we're now obviously at a stage now where we're starting to get towards the recovery agenda, and that, I suppose, is really important to recognise. It's not going to be back to a status quo anytime quickly. The social distancing requirements for individuals and service users means that we can't stand everything back up to being fully face-to-face. So it's a mixed economy between phone and video conferencing and face-to-face where required. We're also a mixed economy between office-based working and home-based working. I think you can see in the cameras the number of us are obviously working from home as part of that methodology, but we're fully feeding into both the council and NHS Lanarkshire recovery programmes as we start to develop that. Another thing that's important to mention is around some of the staff wellbeing work, where again on a fully partnership basis, we've started to develop a whole range of staff supports for this one. And I think it's been a really huge success actually in terms of some of the work we've been able to do and feeding that out to independent providers as well. So we've got things like restrooms in every area, so staff can have the opportunity to find a quiet time. We've got counselling services, like psychology services, etc., all set up and available for staff. And we're currently working through on a partnership basis how we can retain that service from now till the end of the financial year, recognising the fact that this is obviously going to be a continuing challenge. And I think on that topic, I just wanted to take the opportunity to note the fact that this week is Suicide Prevention Week as well. So I just want to take the opportunity to highlight a few pieces of work that we're undertaking across the partnership, led by Lynn and her team. So we're working with all 4 professional football clubs and doing the publicity and events throughout the season with all 4 of the local clubs. And that's obviously been something we've been doing for quite some time, but it hits a really key demographic for us. We've got an Are You That Guy text messaging scheme out just now, which is really targeting young males to try best to ensure that they're looking out for their friends and family and being able to have that discussion. The Are You Good Need to Talk for Children is another one, another campaign, a local campaign that we've got out running, and we're also targeting that through some of our grassroots football teams as well, just to try best to get again that young male demographic. We've got a partnership with St Andrew's Hospice for another campaign about Light Up a Life. And we've got signage in our Mears vans. We've got alerts around suicide awareness through WebEx for all our staff and partners. We're doing face-to-face suicide awareness every Thursday for assets and environmental staff and waste disposal staff. Again, looking at some of the male workforce, which is a key demographic at the moment. We've got multi-agency meetings taking place across a whole range of areas about try best to minimise risk and also try best to target where young people congregate for outreach youth work. We've got our new suicide prevention app that's been released this week. We've got partnership working across our schools, colleges and universities. Promotional videos being made up through the football teams. We're starting to target some other sporting clubs as well. So we've got some of the local rugby clubs, Jog Scotland, golf, etc. We've got our ongoing telephone lines around managing suicide and self-harm for children and young people, and they'll be the children and young people's line will be launched at the end of September. And we're also doing further work around advertising it on buses and bus shelters. So we've got a full programme of work for every day of this week, and I'm happy to share that with members of the committee at the end of the meeting for your own information and awareness, and also for promotion. But I thought it was a key piece to raise, particularly given the potential impact of COVID on mental health, and particularly around the lockdown for those who have been shielding.
Absolutely.
Take any questions on the report?
Thanks very much, Ross. On the latter point there, yeah, the mental health aspect is certainly mentioned within the report, and it might even come up as part of Alison's adult support and protection. I see it's mentioned in there as well. On the overall report, before I take comments, I think we have to put on record, and I know this sounds repetitive, but we profoundly have to record a recognition of the input of staff, both formally as members of North Lanarkshire staffing section, but also the voluntary input, as you referred to there, as Ross, in relation to the people that were kept going with food parcels, so on and so forth. We could never cover all that. There'll be various departments who want to do that. But I think on behalf of this committee, we would formally want to recognise, and it won't be the last we hear of it, our recognition and our admiration of the work that was given and the help that was given by not just paid or furloughed people volunteering. It was a tremendous effort in bringing society together. We're not out it yet. We're certainly not out it yet, but it's amazing what people can rise to when the challenge is placed in front of us, and the consideration for others has been absolutely profound and heartfelt. I think you'll agree with that, hopefully. And on that point then, I'll take I believe that Claire Louise is going to introduce. If there's anyone, I don't see anyone names up here.
Convener, you've got Councillors Weir, Councillor O'Rourke and Councillor Bartley looking to come through in that order.
Okay. So in that order, although maybe subsequent ones, I don't want to highlight any particular part of the report, so I'll take you first, Anne. Councillor Weir, thank you.
Hi, this is a question for Ross. I have to say, I'm coming from a nursing background, not just nursing, but a huge amount of care of the elderly, geriatrics as it used to be called. And I just there's a few questions I want to ask.
Yes, ma'am.
2.5, can I just ask how many deaths in care homes there were last year, just for context. I mean, you've said there's 245 COVID-19 care home deaths, but how many deaths? I mean, and from working in care homes, I know there's a lot of deaths.
Yeah, I couldn't give you that figure directly off the top of my head. I mean, I can certainly pick it up. I mean, what I will say is the fact that we saw a definite spike in terms of additional deaths over and above what we'd expect for that seasonal average, and you can see that very clearly over the months of sort of May, June, particularly within our figures. So you can see there's certainly been excess deaths in comparison to the seasonal norm.
Yeah, I agree. It's just for context to, you know, for contrast and compare.
Yeah.
And can I say there that is a valid point to raise, because when there is the overall report, can we make sure that in context, Ross, that is noted that point, because we will have a North Lanarkshire report on COVID, but it is only but right that we do have that, as you say, Anne, to contrast and compare. If we make sure that's an integral part of it. Thank you.
The second question, with your indulgence, Mr. Chairman, you're talking about testing 20,000 staff tests. How many staff are there in care homes across North Lanarkshire? Once again, to compare and contrast.
I don't know if Maura or Alison got that figure in the top of their head. I'm not sure I've got that. I've got a feeling that it was, and for the whole of Lanarkshire, something like 6,000 to 7,000, was it?
Right, so we're doing.
Yep. Can I just come in?
Right.
Is that okay? The number is slightly less than the overall number of staff, because if people are off on annual leave or off sick, then obviously they're not getting tested, and the people that have previously been tested positive for COVID-19 are not getting tested again, because that can create false positives as well. So the number slightly, it's all of the care home staff, but it's slightly less than the overall numbers, because of that kind of the number of reasons not to test.
Once again, it's just to see how well we're doing to.
I appreciate it, and once again, I would say when the substantive report, all reports are substantive, but when the overall report comes, if these points that are being raised at service committees correctly so today, the officers, I'm quite sure, will be taking notes on this, so that it is seen, and to use the phraseology that Councillor Weir mentioned there, a context of a comparison and a contrast. That is helpful.
And the last question for Ross, do you think, I mean, I'm a believer in things happen for a reason. Do you think there's quite a lot of good has come out of this? It sounds terrible, but you know, the way people have been forced to work in different ways, and I think it's the reports that are coming back, they've had to use their ingenuity. It's going to continue after COVID's gone, hopefully. Do you think it's in some way it's been a good thing?
I think that there will certainly be positives in terms of some of the service change that's come. If you take, for example, video conferencing, we've been doing the rollout of video conferencing probably for the last 4 or 5 years. And we've always seen real benefits in it in terms of, you know, if you take GP practices as an example, for some of the simpler things around medication reviews and bits and pieces like that, where we're asking people to come out on sites. We've also had things like some of the feedback through the paediatric service for some complex cases who go in for review quite often. That actually the hassle of trying to get into the hospital is actually quite large for the individuals, and they've actually found doing some ability to do video conferencing through to the consultants has been really beneficial. So we take those type of examples, the rollout of video conferencing has just accelerated beyond anything we could have predicted off the back of this, you know, and it was something that was an aspiration of ours already. But you know, the ability to really increase that pace of change has come through really loud and clear. So absolutely, there will certainly be areas that we've been able to develop new ways of working, etc. That will certainly be able to be held on to for the future.
Good. I mean, things like things that were thought about for years have come to fruition simply because we've been forced to, and I think it's been great. It's a positive thing. Yeah.
Thanks, Anne. Thanks for those points, and they've clarified and given us meat for thought in other areas of how we'll formulate reports and develop reports to other committees. Is that okay, Anne?
Yeah,
okay?
thank you.
I've been notified it's Pat. Councillor O'Rourke next.
Thank you, convener, and thank you for commending the staff. Wholeheartedly agree with that sentiment. Ross, if I could take you to the delayed discharge 2.22. I've got a few questions and there's a few ifs and buts here. First of all, were patients discharged from hospitals to care homes without the tests, without the COVID test? If so, second point is, was there any concerns raised about this practice from the care homes to us or from us to the NHS? And thirdly, were they raised formally? And if so, again, could you please advise on any responses to the concerns raised? Thank you.
What information we have on that just now, if you give that, because I know there's ongoing, there will be future reports, but if you could give us clarity in Councillor O'Rourke's point just now, I believe everyone's curious as to that.
Yeah, so I suppose the detail I can provide in going forward, I don't have it complete just now. What we are doing just now is a full review of every individual case going back the way. I suppose the assurance I can give you is the fact that everything was done in line with the extant guidance at the time. And what we are looking at just now is, so the guidance at the outset wasn't for a set number of tests right from the outset. So, and when that guidance came in, which was round about the start of May, to start to undertake tests before any discharge, that was put in place immediately. So we are working through the chronology of that, but also then doing a review of every individual case associated with it, so that we can pull through that absolute detail. I think there's an FOI you've maybe seen that highlighted 3 patients in Lanarkshire, I think only one of which was a North Lanarkshire resident or a North Lanarkshire care home. But off the back of that, I think there was 3 cases identified that were discharged to care homes that hadn't had a test, but it was before that date of the new guidance coming in place.
Pat, do you mind if I ask, Ross, those information on the substantive issue there of, they will be covered at parliamentary level as well as by individual councils, but further information will be coming on all this, and that it can't fully be answered just now, you're saying? Yeah,
there's both. We're reviewing it locally, right down to individual case, but there's also a national review of the whole situation being undertaken. And that's been requested back from all partnership areas. So that's been coordinated by Public Health at the moment.
You okay with that, Pat?
If I could just ask Ross again, I understand I've acted by the guidance and I'm not criticising anybody here, but what I'm asking you is, with the guidance at the time, was any concerns raised about that particular guidance?
There was certainly ongoing dialogue between all partnership areas, Scottish Government, Public Health departments around this. So it was an ongoing dialogue. I would say probably the best way to describe it throughout the period. As I say, the detail of this I will be able to provide once we've completed that local review. And we've been pulling together the chronology of all communication going both directions between government and the partnership. And also including, Public Health Scotland, etc. And we'll be able to provide that level of detail once we've completed that review.
It's further information. You okay with that now? It's going to come, that information.
As long as within the further review that we understand if any concerns were raised and if they were raised formally and if there was any and what responses were given to them, I'll be assured if we can get that information when the review comes. Thanks.
Ross, a comment on that will be done?
Yeah, I'm happy to pick that up. I don't know if Morag or Alison have got any further insight over and above what I've said from the Care Home Assurance Group, but I'm certainly happy to bring back the detail of that to future committee.
Well, I mean, we're going to, Morag, you want to say there will be the detailed report, there'll be parliamentary, possible public inquiry. but from the North Lanarkshire, which presumably will be done in conjunction with their health board, so it'll be north and south, that information will come to us locally and be also part of a national reporting system as well.
Yeah.
Morag?
I suppose it's just to make the comment that I suppose at the time you only know what you know, and the importance of the weekly conference calls with care home providers, the managers, was a really good way to share information, to share from all perspectives, from ours, from health and from the care homes. So that dialogue was there right from the start in terms of being really seeing the importance of sharing information and keeping everybody up to date with what would the experience of managing staff and managing people living in the establishments, as well as the arrangements through health.
You okay with that part, with the assurance that it's obviously still an open book, it's not closed?
Information, convener, thank you.
Thank you, Pat. Next on the list, I have Councillor Bartley. Claire, good afternoon.
Afternoon, convener. Again, just reiterate the comments that you made, and also that Councillor Oak made as well. The staff have been absolutely magnificent through all of this. They've had to, come to the plate and do things in different ways that they never ever thought that would have to be done, and I really commend them, like yourself. Absolutely great.
Thank you.
So if you forgive me, as you would expect, I've got questions and comments.
Absolutely.
To go through, and forgive me, Ross, as well. If you want me to stop at any point and you want to answer it and then go on, or if you want to take my questions all in a one, just let me know, okay?
Okay.
Right. The first thing at 2.6 about care homes, I wanted to ask, did you have any problems, issues or challenges working with the private care homes in North Lanarkshire? Was there anything specific that you had any issues with, or was it kind of lessons learned and a two-way conversation?
Can I take that, Claire? Can I take that? Because I don't think we want to lose that. Can I take that one and ask Ross to respond? Ross?
Yeah, so in North Lanarkshire, obviously, we've only got Muir Park in-house, which is an independent, intermediate care home. So all of our institutional care then is therefore within the independent sector. As Morag said, we had weekly engagement sessions with the homes, and have been doing that since the start of March, which has been very, very positive in terms of pulling that together. And that's allowed a sort of two-way conversation throughout the whole period on that. We've also, as was noted through the update, put in a whole range of wider supports and also wider scrutiny as well. So we've been working alongside the Care Inspectorate on a range of other inspections, etc. Through that, and we've also got daily figures come in from each of the care homes outlining their current positions. Again, we've been doing that throughout the period, so that's given a sort of continual data stream in terms of the position of each individual home in terms of outbreaks, etc. And allowed us to sort of target the support and assurance work across the sector.
Claire?
That's very, very reassuring, Ross, because I have been hearing from elsewhere, not within North Lanarkshire, that there have been some issues with some of the care homes who were a bit reticent to provide information because they looked at it as being sensitive. So they were kind of dragging their heels a wee bit and talking about maybe what help they required, or did they need PPE, or how many cases they had. So to know that within North Lanarkshire there has been a partnership is actually really, really reassuring, to know that that has been the case. And I know that that will have been a lot down to the hard work of yourself and the other officers and staff that have been involved in this. So thank you for that.
Can I just come in there? Ross, could you just to clarify that point, as Claire has quite come back at there? You're saying that in relation to the private care homes, because we've only got Muir Park ourselves as you're saying that in general, or is it just in general, there was a willing partnership with private care homes in North Lanarkshire? Or was there, without naming anyone at this particular stage, or was there significant reluctance from any individual or collective of care home groups to actually follow and play a part in addressing the issues?
Yeah, I would say it was universally really pretty high engagement. I'll bring Morag in because Morag sat on the daily calls quite often, or the weekly calls, sorry. But I would say over the piece, I think we've had incredibly high engagement. I mean, I know over the last few weeks, even now, still obviously quite some distance into it, we've still been reporting back 93 care homes have submitted information out of 93 in Lanarkshire. So I think we've had I think a pretty positive engagement. I suppose it's important to say as well that we've been doing this for the other supplier groups as well, so not just for care homes, we've been doing it around our SDS support providers, our home support providers, etc. as well, having that sort of weekly dialogue to make sure we've got the same level of engagement.
Morag, do you want to make a...
Just to totally agree with what Ross said there, I think the 93 care homes are across the whole of Lanarkshire. North Lanarkshire has got about 28, 30 of them. And we had really good engagement in the calls right from the beginning. Often if somebody wasn't able to attend, they spoke to one of the senior officers before or after or both to make sure that they got information. We tried to get the minutes out really quickly so that people that weren't able to attend got the information, but generally speaking they weren't able to attend because there was a conflict of calls that they had to participate in rather than a lack of willingness to engage. And just to give an example, obviously personal protective equipment has been a complex issue through the experience of COVID, and the willingness of the homes to share with each other, to share information, for us to share PPE with them is a good example of, there was really a very positive approach to working together and a sense genuinely that we were in it together, which was really encouraging.
Thanks, Morag. I'm glad you raised it, Claire, because it clarifies the situation, and it was just a case of, I think I felt anyway, probably as all, no news is good news from the North Lanarkshire perspective. I know that sounds own backyard, but that was the way I was feeling at the time, and still do to a certain extent.
Yeah, no, thanks for that, Tommy. And thanks, Morag and Ross, I really do appreciate that. Moving on to the assessment centres, I think it was a marvellous idea. One of my close friends is a doctor, and she worked in it and said that the way it was set up, the way it was working was great. On one hand, it's really good news to know that it's moved down to just having one, that there's only a need for one. But it's just to check. I'm hoping it's not. Hope there's no need for it. But is it kind of in a position that could upscale again if we went down coming into the winter, and God forbid if there is an escalation of the number of cases?
We'd all be interested in that response, Ross.
Yeah, there's a work stream underway nationally around urgent care, and one of the aspects of it is having a look at assessment centres. The big challenge that we're anticipating in winter is how do you differentiate between normal seasonal flu, cold, respiratory type illness and COVID. And there's a work stream underway that's starting to have a look at what a respiratory assessment centre model would look like. So I don't have a sort of final answer for you on that, other than to say that work is underway. But the turnaround time for that is the first week in November. So by Halloween, they're expecting to have a finalised national model that will be rolled out across the health boards. So I think the natural sort of winter illness will mean that retaining a sort of COVID approach will be quite a challenge, and it likely will end up being widened somewhat into respiratory.
Okay, Claire, will probably be part of the next report.
Yeah, we're learning all the time. Yep. It's moving. Yeah. My next part was under 2.13 and 2.14. It was about the mental health assessment centres. Now, again, it comes into it's giving the numbers of people that went through the different centres, but there's no outcomes. And I have concern, there's obviously been this week, particularly because it been suicide awareness, but there's the concern over mental health and referrals, especially for young folk, taking longer. That is, it's not just about, for example, 405 patients were seen in Monklands, but what was the kind of outcomes for those people? Was it a case of they were seen and where was the next move? Was there an extension of how they were then looked after? It's just to give a wee bit more information on that side of it.
So I think the main context for this one is the fact that we've probably not seen any significant increase in terms of volume. So I suppose what's changed here is how we've managed the assessment process for these individuals. So up until now, that those individuals would be seen by a psychiatry liaison service on the acute sites in the EDs themselves. But because of the fact that they were trying best to change the emergency departments into green and red flows for COVID and non-COVID, that was becoming quite problematic in terms of space. So taking, I suppose, advantage of some of the stepping down of some of the wider outpatient services in hospital, we're able to create mental health assessment areas. So ultimately what we're doing here was trying best to free up the emergency departments to deal with the absolute emergencies and remove those patients out of that probably quite stressful environment because of the COVID pathway out to a more appropriate area in the hospital. So the actual numbers haven't changed significantly through the period. I suppose the ongoing nature of support, either back through the community mental health teams or through the distress brief intervention programme, again, wasn't particularly changed through this. This was more around a focus on supporting these individuals to be seen in a more appropriate environment and freeing up the hospital to deal with the cases that are absolutely needed to have in the emergency department.
Okay, thanks for that. I'm on my penultimate one for this one. The delayed discharge. Said there was a new model that was trialled in Hare Myers. Can you either, it might be a bit much to ask you to give lots of information here, but can we maybe get more information on kind of what the trial was about, what the good points, the bad points, what, you know, that kind of side, a wee bit more information on it?
Ross? Ultimately, this is the planned date of discharge model, and ultimately what it's doing is trying best to set up, right from the point of somebody coming into the hospital, the discussions kick off immediately around how you plan to discharge the individual. And the aim is to set as quickly as possible a planned date that you'd be aiming for. And what we aim to then do then is start to have some of those sort of multidisciplinary team meetings around those individuals so that we can start to work up that package of care. What happens at the moment is we tend to wait until somebody is clinically ready, there's a referral through to social work, and then the process kicks off. But the aim by starting it much earlier in the process is that we can involve families, carers much earlier, and also then do a much greater joint workup of a package of care. So it's had a really significant impact in Hare Myers. We've commenced rollout of it in Wishaw. It started in Ward 9 last week, and we've got plans to roll that out into Wards 10 and 11 in Wishaw. And either by the tail end of this week, starting next week, we'll be kicking off Ward 20. Care of the elderly ward in Monklands as well. So there's a plan of action now to roll it out, again, roughly over the sort of next 8 weeks across the Wishaw and Monklands sites, but it should make quite a significant impact in terms of how we deliver discharges across the partnership.
Oh, that's good.
I think we'd agree, Claire, that paradoxically, this is another one whereby a problem actually identified to be resolved produced a change in working practice, which is absolutely a progress rather than a regressive situation. You said 10 ultimate, so this will be
last one.
The ultimate.
Last one, and this is under the test, trace, isolate and support. And this is more of a comment, and it's already been covered by yourself, convener. The response from the community has been absolutely phenomenal. There's individual organisations that give me praise from every single one of our wards. I praise Cumbernauld Resilience, obviously, because it's in my patch, and the work that I did with them. There's equally organisations throughout, but it could not have been done without the work that was done by the officers, specifically CLD, and people who made up the lists, who gave us as councillors the lists of the organisations that they were getting in, who was the contact, putting everybody in contact, allowing us to be in a position to be able to get people to link up. So as you say, the amount of packages and everything that went out was absolutely was phenomenal, and it kept so many people who would have fell into that gap. It got them the support that they needed. So I couldn't really praise it enough. And I've got one question about that. Did they find that when the list of people who are shielding, who are the vulnerable folk, has that been cross-referenced with social work to see, is there actually anybody who has kind of fallen into a gap that social work were not aware of, that would have now been highlighted under shielding, that these folk would continue maybe to get support elsewhere? It's to look up to make sure, because I think what's so important of what has been done and how all of this has been working for council, as you said yourself, convener, every single committee is looking at the implications of COVID. So it's looking at that joined up approach of looking maybe at the individual and saying, how has this individual been affected, and making sure that we don't lose them again. So really is the question, is there anybody that's been flagged, that was flagged under the shielding, that social work were not aware of? And is that the way of thinking going forward?
So, Ross, is that a logistical issue that maybe Morag is more in a position to clarify, or do you want to make a comment?
I was just going to say, I'll bring Alison in as well, but Alison. I was just going to say that right at the outset of the process, that we did a cross-referencing between Swiss, the GP information systems, etc. as well, and also the information that was provided corporate or centrally from Scottish Government around shielding. So we built up the list of shielded individuals based on those parameters. But I'll bring Alison in.
Alison?
Yeah, thanks. Yeah, just to confirm what Ross has said, I suppose the implications of that were it allowed us to know on social work's record system if someone was shielding, so that we were aware of that, and that clearly, I suppose, reflected both us being cautious and taking the appropriate risk measures in terms of any direct contact then in relation to people, as well as being aware of their situation and the potential need for further support. The other thing that we did at the turning that around is that although it was our housing colleagues that led on the support for people team and the calls and the coordination of support to people who were shielding, we did link one of our senior social workers from Access Social Work into that, both to provide advice to that team and training in the first instance when it was being set up in relation to what might be an appropriate request for assistance to social work and what supports were around, but just to help the team more broadly in making sure that requests for support were being directed appropriately, and also it allowed us to pick up anything where it was more appropriate that there was a social work response to and deal with it through our system. So there was quite strong collaboration throughout in terms of the way that these systems were developed.
That give reassurance, Claire?
Thank you. Thank you. Thanks so much. Thank you for that.
Thanks for the comments. Folks, I understand this is always going to be the report that was going to be analysed, and I'm taking everybody's points and questions with no rush, because I think the nature of our committee, it was always going to be the one that by its nature was going to be given this type of analysis. No disrespect to the other committees, I'm not saying that. They will analyse in their own way, but we're in no hurry to get through this. If you're okay with that, Claire, I think it's, if I can clarify through Claire Louise, is it Councillor Feeney that's next?
Yeah, Councillor Feeney's next.
Okay, Angela, afternoon.
Hi there. I'm really wanting to just pass on my thanks to the Social Work Committee and to Ross and Rolly's staff. I work in the district, and coming across social work staff, your home care support workers, they really went above and beyond. It was a totally different environment for everybody to be working in. They were scared like everybody else. Many people were home furloughed, understandably. It really did step up to the mark. They were going into patients' houses, that were seeing family that had dementia, were very scared, and they really did step up, went above and beyond. And I think what this crisis has shown is who the real key workers are, and what the public sector is all about. So I just really want to pass on my thanks to all your staff. Thank you.
Thanks very much, Angela. Absolutely. It's possibly something that should be specifically highlighted, is the figure there that you're talking about. Almost 700,000 home visits in the period of this report, and that was only up to August. Absolutely phenomenal. Thanks very much for those comments. There'll be part of a comment that we'll make at the end, and possibly say that we're united as a committee to thank everyone in those specific services. Thanks, Angela. Next on my list, if I'm right, Claire Louise, is Councillor McNally. Frank?
Yep.
Thank you.
Thanks very much, Chair. But you'd be pleased to know, and I absolutely share your comments and everyone's comments about the work of the staff within the service, and the relationship clearly with public health is incredibly strong within the NHS Lanarkshire, and that's a testament to everyone. So I absolutely welcome that. But you'll be pleased to know that Councillor Bartley asked the two questions that I had, and I've got answers to them. So I'm perfectly happy to move on to Councillor Burgess.
Frank, I was hoping that by deductive logic or by statistical possibilities that there may well be the case that Claire's multifaceted question would knock out some of the rest of you. I don't mean any disrespect.
It's not planned. It's not planned.
No collusion. No, thanks very much, Frank. And as I said, we'll unite in how we should make our feelings towards all involved in a statement at the end. So next on my list, and Claire Louise can clarify if I'm wrong here, is Bob, yourself, Councillor Burgess. Afternoon, Bob. Bob?
Yeah, I'm on.
You're on mute.
Yeah, it's just no. That's it. Can everybody hear me?
That's
okay?
it, Bob. Yeah.
Yeah,
can hear
lovely,
you.
thanks. Been having big problems. I don't know if it's my machine, but I've lost half of the meeting today. I don't know if the rest of you have been the same, but I've lost quite a bit of it. But basically, I've got two questions. One on the staff situation, Ross, if you could let us know how many staff people were affected by the coronavirus and their mental health. Could we get some kind of report on that? And is there any problem on the new staff, i.e. with training and such like?
So in terms of staff impact, I mean, I think the initial projections from Scottish Government were that it could be anything up to 35 to 40% of the workforce off at any one time. And I think what we found was through shielding, etc., we were a maximum, I think, around about sort of 10 to 14% was the peak. So it wasn't as high as initially projected from the Scottish Government. In terms of mental health, we put a whole range of measures into staff mental health and wellbeing. And I mean, I think both locally and nationally, there's been a whole range of work put in here. I was speaking to one of the coordinators around the national system, and they were saying through the national helpline after the first 2 or 3 weeks, they'd only had 20 individual separate contacts through the system, so it was nowhere near as high a demand level as they're potentially expecting. That said, they were quantifying or noting the fact that was also in terms of post-traumatic stress disorders, etc. It would normally be about 6 months before they would start to see that type of impact, which would always be too soon for just now. So we certainly haven't had a huge impact in terms of mental health and wellbeing through the staff support lines, etc., that have been put in place. But I suppose we do need to have a look at what impact that will have. We have stood up our MIST arrangements, which is the mass incident support team arrangements. So we've got champions in every local area that will provide additional support and counselling to staff that have been affected by an incident. So those arrangements are also now live to provide that sort of one-to-one support for staff within each area. So there's a lot of work's been done on this. I think we've had a bit of national recognition in terms of the wide variety of different schemes we've had in place across Lanarkshire. And as I noted earlier, we are continuing to now look at that one in terms of sustainability to run it right through the winter months and through to the end of the financial year as well.
Ross, am I right in saying that the impact, Bob, I take it your question was more in relation to the impact of COVID and staff attendance. Yeah.
Yes,
I
it
just
was.
want to develop that and say that the performance report is done quarterly, and the one we have today literally takes us up to when COVID kicked in. So the subsequent performance report at the next committee, that presumably will include the impact and figure for them. I mean, we've got from January to March here, but the impact of the COVID absentee figures and the analysis of that presumably would appear in the subsequent report of the next cycle.
Yeah, it would do.
Right.
Yeah.
You okay with that,
I suppose
Bob?
what I would say is it's been nowhere near as high as initially projected, because we were projected initially around 35 to 40%, but it was never anywhere close to as high as that.
Well, when we're formulating the report, if we could make sure that that is part of it.
Yeah, happy to pick that up in the next performance report.
Yep.
Tommy, can I just ask Ross one other point? It should be quite quick, I think. Who do we depend on for the supply of PPI, and is it the procurement of it? Who do we depend on that?
Ross?
So there are different aspects of this. So largely for our in-house PPE for social care staff, that has been through National Services Scotland. So we've got a system set up through NSS that allows us to procure PPE for social care through that mechanism. Through the independent providers are expected to purchase their own, but where they struggle, they can then access it through the NSS stock as well. So we've got a process in place that allows the NSS supplies to be distributed out wider to independent providers where it's required. And then from the broader council perspective, so for the non-social care staff within the council has procured its own PPE directly.
Bob, you okay with that? Right, can you hear me okay? Yeah? No? Is there anybody else having difficulty? Because I'm hearing everybody as they're coming in. You just wave. Is it just Bob?
I'm having difficulty with mine, Tommy.
Yourself, Sandy? Is that true?
Particularly the sound.
Could we just, right, whatever it is there, Claire Louise, if we can just tinker away. Bob, are you okay? Okay. Got the nod there, seems to be okay with that. I would say, if you can hear me, that there was a report went to, because of technological reasons, as Andrew Rose knows, I couldn't make the audit and scrutiny last week. But the last item in audit and scrutiny was an audit on the health and safety, and it included PPE supply. So that's an interesting report that maybe is worth a read for everybody. Bob, but that will clarify, because the auditors looked at how we address the COVID in relation to that particular aspect, provision of PPE. I was actually going to ask the question you were asking at the committee last week, so I'm glad you raised that. Next one on my list, if you can hear okay, is Catherine Johnson. Mrs. Johnson, good afternoon.
Good afternoon, convener. Well, like Frank, Claire went before and has answered most of my questions. Obviously, from this report, there's been some wonderful work done. And I've really just got one question left to ask. How many private care homes were we dealing with during COVID? There's no mention of the number.
I heard you mention the number 28 earlier. Could you just confirm that?
Yeah, there's 96 across the whole of Lanarkshire, which we've been dealing with. Our care home assurance structures are all done on a pan-Lanarkshire basis. There's 96 across the whole of Lanarkshire, and I think the North Lanarkshire cohort of that is round about 30, 31. I think Morag, I'm hoping knows it. It's round about that.
Yeah, there's 28 that are specifically older adults, and there's a couple that are registered for younger adults as well. But and we've got, as Ross said, our own intermediate care. So depending on what you're counting, it's 28 or 31 or 30.
It's a point that will be included in subsequent reports.
Right, thanks very much. That's all I wanted to ask. Thank you.
Thanks, Catherine. Thanks, Mrs. Johnson. Now I've got notice in my machine here is Colin. Mr. Cannon.
Yes, thank you, Tommy.
Thank you.
Please forgive the lack of video. I have had issues in a couple of meetings with dropping out when I had the video on. It's more to do with the amount of people in my street actually working from home and the available internet capacity. So I have a couple of questions and a comment. I'll start with the first couple of questions, and I would like to echo my thanks for the amount of work that's been done by the officers. The first one is I'm aware of at least one case in where, and I don't know if this will be for the substantive report or if this would actually fall under a different committee, but I'm aware of at least one case where a resident in the care home passed away without a COVID test. They were classed as a COVID death on their death certificate, and that the family's actually fighting that decision. I'm looking to find out if there's numbers on how many cases like that there are. I'm aware that might not be this committee, or it might be for the future substantive report. I don't expect an answer right here and now. Again, this is my second question, might be for the future substantive report. I'm aware of the amount of assistive boxes that went out to everybody, and that was brilliant. But I'm also aware that a certain percentage of them were misdelivered. It was to find out if we've got a figure for that, and if we know if all of them were collected back or not. The reason I know that at least that it's happened at least a couple of times is because my neighbour's one got delivered to me, so I contacted and that was picked up and taken away. I hope people actually did that. And the final comment I would say is I want to thank the officers for the assistance they were given to the carers that don't fall under any of the preordained categories here. We have a number of people, I think it's in one of the future reports, it's above 200 people that are on the self-directed support that direct their own support directly, not through one of the SDS companies. And I'm aware that of the amount of assistance that were given to those private carers with certification, so that if they did get stopped by police during the lockdown, they weren't falling afoul of any regulations. So I'd like to thank the officers for the amount of assistance there was during that.
Great, thanks, Colin. On the last part, I think that's coming up in a subsequent report later on. I think it's item 4 or item 5. But Ross, the first 2 points, there may well be legal technicalities or legal restrictions, but on as much as possible that you can give at this stage.
Again, this comes down to the change in guidance in terms of how we manage this. So in any sort of normal outbreak, pre-COVID, any normal outbreak would be managed in a set way, whereby, so if you take a norovirus outbreak as an example within a care home, there would be a set number of the initial tests of cases would be tested to check it was norovirus, and anybody who's symptomatic beyond that point would be deemed to have norovirus without having to go through the test. And that was the same procedure that was put in place for COVID at the outset of the outbreak. So they would test a number of residents at the start of the outbreak, identify the fact there was COVID within the home, and any subsequent cases with those symptoms would just be deemed to have COVID, whether or not they were tested or not. And as that then went on, we then were getting towards the stage as the outbreak developed and the guidance developed, that changed so that we ended up testing all symptomatic cases and then all residents within a care with the guidance at the time. But that was, it's I suppose, a sort of standard way of managing the outbreak through health protection, and that's really the outputs of it. In terms of the missed deliveries of the assisted boxes, I don't have those figures, and I do guess they probably will be picked up, whether it's through the communities committee or not. I'm not sure where Andrew's reporting the outputs of that, but I know it's not through ourselves. But I can certainly I'll raise it with Andrew to make sure it's picked up when it does come through the full report policy and strategy.
That's great. So, Dave, Colin, I know that there wasn't a lot of detail in the specific cases there, but it's maybe an element of restriction there. But are you okay with what the response has been there from Ross on those two issues?
Yeah, I'm quite happy with the response. I did understand there wouldn't be any detail at this committee because it was likely to be either restricted or information that wasn't available. And I'm quite happy for the thing on the boxes. If that falls under the purview of another committee, for it to go there, it's just so long as we're picking up so that somewhere, it's because it would be useful information. I fully expect the majority of the boxes went to the right people, but it's just to keep an eye on things.
Andrew, any comment to make there? Is community empowerment or rather picking that up?
I don't know if Ross was meaning McPherson.
Yeah, I was.
Okay.
Yeah, Andrew McPherson was leading the work, so I'll pick it up with Andrew to make sure that we do feed it back into the system.
And just drop us all an email on that one to keep everyone in the committee up to date. Thanks, Colin. And next on my list, I have Councillor Baird. Davy, good afternoon. David?
You hear me?
I can hear you now, Davy, yes.
Oh, good. It's just a simple one in this one, and it's go back, and sorry, Ross, if I make you out to appear to be an Uber geek, but it was just going back to your phraseology, on the matters that Claire had raised about the private care homes and the high-level engagement. Could you break that down into common speak for us? What were you actually meaning, or what were the processes involved with this high-level engagement?
So,
Ross, do you want to respond, or Morag, having dealt on a daily basis between the two, can we just give a development of that point?
I mean, I'm happy to kick off and bring Morag in. Ultimately, I'm just saying the fact that we set up a range of different communication mechanisms between ourselves and the care homes, and the care homes engaged in it. So that I think the concern was that being independent providers, they may decide not to get involved in some of those work streams across the nation, but locally we set up those sessions on a weekly basis, and on a weekly basis we got a high number of those homes taking part in the calls, but not just being in attendance, but actually engaging in them and being involved in them. We also had a range of the homes actually starting to provide some support and cover to each other as well. So that they were just actively participating in the process rather than just being present on a call or whatever, just to be seen to make up numbers. But I'll pass over to Morag, who can fill it in the details of the calls.
Morag, thank you.
Yep, and I suppose just the people on the call included officers of the council in relation to contract monitoring, standards monitoring, but it also included representatives from Scottish Care and from the wide range of parts of the health service that have a direct responsibility for the quality of support as well, and the care inspectorate. So each of the agencies involved had their own way of linking with the care homes and that collective way of doing it as well. And the care homes, as we said, were regular attenders at that, active participants, and each of the agencies were able to raise and share issues. And as the care home assurance process was developed, that gave us a kind of tighter way of being able to make sure that all of the individual linking with the care homes was brought together, and a RAG rate and a priority was put on the arrangements and the linking arrangements with each of the establishments. which they were complying with and happy with, because it was done in the spirit of being helpful and protecting the most vulnerable people. Yeah.
Thanks, Maura. Davy, would you be okay if I said that in future when this comes up in reports, either in the substantive overall report, that when there's talk of the relationship with care homes, that we don't just use that phraseology that was used there high level, that it is spelled out that it was multi-agency and the ones that Morag outlined there were all involved at those particular stages. I'm quite sure it's the intent to have that within the report, but we'll make sure it's in there.
I think it makes it more easily digestible by ourselves as councillors who are not aware of the processes and that. And I'm quite grateful for the answer that both Morgan and Ross have given us. But if you don't mind, just wondering, was Public Health Scotland involved in any of this directly or indirectly? Were there?
Not in terms of participating in the meetings. Public Health Scotland really set out the guidance, but largely they rely on the local health board, public health teams and health protection teams to do the sort of operational local elements. So as part of the Care Home Assurance Group, we've had the Director of Public Health and one of the public health consultants. We've got a named public health consultant in the Lanarkshire team who has just had a remit change to being around care homes throughout the outbreak. So we've had that local engagement.
Thanks, Ross. And the question crossed my own mind prior to the papers going out on committee as well, David. Are you okay with that?
That gives a full explanation. Thank you. Thank you.
Now, I don't have any more names up here, and I know we've taken up some time, but it was my intent to take up some time because there's cynicism, and sometimes that's natural in the public domain that too much is not getting answered. I didn't want anybody leaving here today, certainly with the nature of that report, with the impression that things weren't answered. Whatever we wanted clarified, we've had clarified. Whatever we needed to ask, I believe we've given the opportunity to ask. Can I just end by thanking you for reinforcing the points I made? And I think that when any public statements made that we met as a committee, thanking the staff, that we make sure that it was unanimous and across the board and that every councillor made congratulations. And I've always said it's not a service that should be politicised. It won't be politicised, but it will be made clear that as individual councillors and officers, as a council, we appreciate what's going on and what continues to go on and the way it's being addressed by our people within our communities. That okay? Thank you then. I don't see anybody coming in with any amendment. So, if we can agree to note that report, knowing that it will be part of a more detailed report that will come months down the line to policy and strategy, and move on to what in this time, ironically, is a retrospective report. It's the annual report on adult support and protection that Alison's here to take us through. Thanks, Alison.
Okay, thanks, convener, and good afternoon, everybody again. As the convener indicated, this is a retrospective report, so the large part of it covers activity between April 2019 and March this year. Although those of you who've read the backing report as well as the cover report will see that there is a little bit of an update provided at the beginning in relation to how adult protection arrangements were discharged during the early period of the pandemic as well. So the introduction to the report just is there to remind members about the sort of legal context of the adult protection activity that's undertaken within the service, and give some sense of the scale of that as well. It's very much collaborative and something that is undertaken with partners, and we've got strong links to the Adult Protection Committee who oversees that partnership element. But this report deals specifically with social work activity. Social work has the lead role in relation to adult protection inquiries and investigations. And it's a really significant part of the adult social work team's workload, and clearly critical to the welfare of vulnerable adults within the community as well. So you'll see at 1.3 of the report just a reminder about the legal definition of adult at risk under the 2007 Act, and that's commonly referred to as the 3-point test. And that's really the trigger for an adult who potentially being considered within the responsibilities we have in this legislation. You'll see, though, in the body of the report that over and above the adult protection activity that we receive referrals that we need to respond to, there is a high level 2 of adult concern reports from the police. So these tend to deal with adults who are not considered to meet the 3-point test, but where there's worries about their welfare, and an ask that we look at some degree of inquiry or assessment around that. So in the main body of the report, you'll see summarised that we had just over 2,200 referrals in relation to adult protection over the prior year, with a sort of 50% higher number, just over 3,000 adult concern reports from the police. That was a slight increase in adult protection activity, the first increase over the last few years after the initial years after the legislation was enacted. There was quite an exponential growth, and we do sit nationally as having quite strong awareness of adult protection issues and a high level of activity in North Lanarkshire. In contrast, adult concern reports from the police decreased slightly over the last year. In terms of who's referring concerns to us under adult protection legislation, there has been a decrease in referrals from the police over the last 2 years. That really reflects, I suppose, a sort of more stronger screening arrangements by the police themselves through the concern hub as arrangements have matured, and the police being clearer about distinguishing between adult protection and adult concern referrals. You'll see, though, that referrals from health colleagues as well as from social work professionals themselves in terms of identifying adult protection concerns, there has been an increase in the proportion of activity that has come from those agencies over the last year. Given the discussion that we've just had, members will be interested in 2.4, which references activity round about care homes and the fact that over 2019-20 there was a 9% increase in adult protection referrals from care homes. I think that needs to be set within some context, which is around the increased complexity of adults who are being supported within care home settings. And this is something that we've been tracking really carefully and on a weekly basis through the pandemic period as well, through our care home assurance activity, and would normally do also through our adult protection leads and our quality assurance section. And what I can say to you, which would provide maybe some degree of assurance, is that the highest reporters of adult protection concerns in care homes are the care homes themselves, and that most of those referrals relate to concerns about behaviour between adults who are being cared for, rather than quality of care issues, although there are some of those too, and clearly where they are, we respond to them appropriately. There are other sort of features that are maybe worth highlighting in this year's report is that whilst adults who have mental health difficulties continue to feature as quite a high proportion of those for whom we have adult protection referrals, there has been a slight decrease in referrals for that group over the last year. Now, one of the things that's highlighted is a correlation. We can't yet see a cause between that and the upscaling of activity around distress brief intervention, which is a sort of programmed response to get support quickly, an early compassionate response, and quick interventions for adults who are experiencing distress, and that includes adults who may previously have arrived at hospitals for unscheduled care as well because of mental health issues. So that there has been a pilot in the Lanarkshire area, and the activity around that has extended over the last year. And whilst we can't yet say, as I say, that has caused the decrease in adult protection referrals associated with mental health, there's certainly a correlation. For those adults where there are more complex needs or significant concerns identified, there have been you'll see that 20% of referrals for adult protection led to full comprehensive investigations, and the other referrals being able to be managed after initial inquiries through alternative responses. That's a slight decrease in the proportion of investigations from the previous year, but there's a higher conversion rate into case conferences, which are when clearly multi-agency colleagues come together to make sure there's an appropriate plan to safeguard that adult. In addition to the activity associated with the investigations and dealing with adult protection referrals, 2.7 of the report just gives a bit of a broader flavour of wider safeguarding activity, and particularly references guardianship and social work officers' role in relation to guardianship. So you'll see that we have had involvement with about 1,000 adults who are subject to guardianship because of a lack of capacity in key areas. 200, just over 200 of those are adults where the local authority holds guardianship for, where the rest are private guardianships. So generally a family member will have guardianship, but the local authority has a supervising role. And then in addition, there's information about appropriate adult duties, and that's quite significant. We have an appropriate adult service where a number of our staff are trained to particularly offer that service to adults who may require to be interviewed by the police when they are considered to have a mental health disorder. At the 2.8, there's information about significant legal activity where we've taken banning orders where there have been significant concerns for adults to safeguard those, and that's probably the sort of a relatively small number, the action that is required for adults about whom there is I suppose, the highest level of concern about their circumstances, and that's the only route to safeguard them. The rest of the report really just gives a flavour of the ongoing improvement activity that's undertaken around adult support and protection. There's certainly more of a national driver for that than there have been in the past, as national arrangements have matured. There's external inspection activity that was paused during the pandemic period, being undertaken across all partnerships in Scotland around adult support and protection. That has been unpaused, so to speak, just now. So we do expect, as a partnership, that we will be inspected over the next few months in relation to the quality of our adult protection responses. In the interim, we continue to follow through the range of performance management and improvement activity that's listed both in the cover report and in the more detailed report. So that clearly includes monitoring of activity, and then referrals. We've strengthened some of our procedures and governance arrangements, auditing of case files, and a lot of development activity with our staff. So it's a significant part of the social work activity within adult services. So it is important that you as members are cited on that. There's much more detail in the backing report. I'm happy to take any questions, but otherwise just asking for the report to be noted.
Thanks very much, Alison. The back-end report certainly is very interesting and develops the points you highlighted there. Before I make a couple of comments on some aspects of it, all positive, I noticed some councillors I've got names down here, and Colin, I've got yourself down first, followed by Claire. Colin?
Yes, thank you. And let me start by apologising. In the last report, I forgot to use your proper title, convener. No disrespect is intended. I know you probably didn't take that the wrong way, but I still thought I better apologise to start with. Right. My question actually is regarding a graph we've got on page 10 of the appendix, which is page 28 of the papers. And it's a breakdown of referrals by age. Now, I do notice that from the age of 70 onwards, there is a rise in referrals for females rather than males. But when we hit 80 and above, it almost doubles. Now, I was looking to find out, and there's no nice way of saying this, there is a differential in life expectancy between male and female. I was looking to see if this was a reflection of that, or if there's some underlying issue that we actually need to look at for the older female inhabitants that we should be studying, or if this was just a reflection of the differential in age.
There's an interesting narrative to these graphs, Alison, but on the specific point that Colin's asked, could you clarify?
Yeah, I mean, I think it's an interesting point, and I think it's a differential that we've been tracking, both in terms of age and gender differential from referrals, and certainly part of the answer very much is in what Councillor Cameron has highlighted in relation to the different number, the longevity, I suppose the greater longevity of the female population on average. So that's certainly part of the answer. It's something that we continue to analyse and reflect on. We don't. I can't say to you that there's another specific reason for the trend. I think it's something that is an interesting question that we will need to continue to look at. There are some other features within that, but I don't think they're so prevalent within that age group. So if you consider that there's a crossover also between domestic abuse and adult protection, that sometimes in some areas would lead to that crossover of having more referrals in relation to women. But I think we would need to go back and break down the reasons to give you a full answer to that, Councillor Cameron. It's certainly something we can explore, and we could also certainly track, as you'll see in the supplementary report. One of the things, there was discussion earlier on about improvement activity and how COVID has got us to think differently. We have been tightening in terms of our regular meetings to analyse our adult protection activity. Week to week business, there can be fluctuations, but we're doing, as it says in the report, a more in-depth analysis every 10 weeks now, and certainly that's a question I'm happy to take back to the team to ask them to have a consideration of when they're doing that analysis.
Excellent, Alison. Yeah, the various aspects to it, Colin, you know, the men under 65 more likely than women, you know, it changes, and it'd be interesting to see some follow-up analysis and reporting on that at a future date. Colin, any supplementaries?
No, that was everything. Thank you. It was just with the doubling, I was concerned there might be an underlying issue. I thought there would be a look into it already, and I'm glad to hear there is. Thank you.
Yeah, but the analysis of that will be interesting, and I'm no harbinger of doom and gloom. The analysis of the whole issue, the report next year, will be very interesting in relation to COVID, what we're going through just now, when it's reported next year. And it'll be interesting to see sort of comparison with what we've got in front of us just now, which I dare say would be seen as quote unquote a normal year with changes there. And so thanks, Colin, for flagging that up. And next I've got is Claire Bartley. Claire?
Convener, sorry.
Convener, I think it's Aggie McGowan, Councillor McGowan, it's just before me.
Sorry, Agnes. I've seen you down there. I was bringing you in next, but on you go. Sorry.
No problem. I'll let you off time. Won't do it again.
Right. Thanks, Agnes.
Now, I'd just like to thank Alice for all the work you and your team is doing in the field of adult support and protection. It's fantastic. And I was delighted to see that the referrals for adults with mental health was down by 7%. And there was a correlation with the distress brief intervention. And I put my name in a wee bit too early because Alison did a wee bit of an explanation of the distress brief intervention. I had never heard of that before, and I just wanted a wee explanation of that. But you did give us an explanation, Alison, so unless you have any more to add to it, that was my only question. But well done to your team for all the work you're doing. Thank you.
Yeah, thank you. And we probably will report further on the distress brief intervention work in the context of other reports around mental health going forward to committee, but it's certainly been a positive development. I think it's diverting people, and it also offers a personalised immediate response to people, and it's something where we've seen that a partnership with a specialist third sector organisation has delivered real positives for us. So whilst we're one of the pilot areas, it's going to be developed nationally, and I think certainly it'll be something that we will report further on to committee over time.
Thanks for highlighting, Agnes. It's certainly a positive aspect of this report. But pages 32 and 33 develop those points that you mentioned and that Alison developed. Excellent. If you're okay with that, Agnes, I'll now turn to Claire. I'll bring you in at the right time. Thanks, Claire.
Thanks, Convener. Just again, another great report. Thank you so much for this. One of the questions I had, and Alison, you did answer that, was about the referrals reducing from the police. And it's good to see that it seems to be that now there's a bedding in of exactly what the terminology is and which track that people should be directed under. And that's really good to see that, and it's really good to see the excellent collaboration with the other agencies within this. The ASP Service Provider Group again is a really good idea. I'd like a wee bit more information on that, of who's on that, what is the makeup of that group, and I don't know if you want to answer that, and then I've just got another couple of questions.
Right. No problem, Claire. We'll take that one first. Thanks, Alison.
Yeah, it's really it's sort of very similar in some ways to the ongoing the partnership arrangements that Morag described in the context of care homes, and we have them both with providers of adult support through self-directed support and care home providers in relation to, I suppose, strengthening their confidence in both, identifying and dealing with adult protection issues that may arise. And I think, it has been one of the things that has helped us. When I'm saying that there's obviously naturally a concern around the level of referrals that come from care homes, but the fact that care homes themselves are identifying issues that might need to be explored and where they might need to have a response in place to ensure an individual's safeguarded within their situation is clearly important. So I think it's our approach to this has been very much mirrors our approach to some of the other development activity with providers, which is to see them as partners to try and assure they understand both our and their obligations in relation to key areas, and it's been very much to strengthen that, as I say, that overall response, because there are certainly some areas of adult protection that create more challenges than others. One's referred to in the report, for example, including around self-neglect being an issue. So it's to try and just acknowledge that this is a complex area to deal with, and strengthen our ability to deal with that as a system, rather than it be something where it's seen as, clearly there's an element of scrutiny that we bring to the process, but it's not just us policing other people, it's trying to build all of our capacity to deal appropriately to concerns as they arise.
Thanks, Alison. Claire, that bit of detail there.
Yeah, thanks for that. Again, it kind of comes back to conversations we've had at different committees where, because the figures go up, it's not necessarily a bad thing. It's because of a realisation that people know what the process is, and it's actually picking up people that otherwise might not have been picked up previously. So the cases rising is actually showing how strong, you know, the system is to do that in the process. So thanks for that, Alison. The other thing I had within the report was about the postgraduate certificate at the University of Stirling. And it's just saying that obviously for 2019-20 there was no availability on the programme, but there was hope that there would be for 2021. Now obviously COVID has changed so many different things, and I know that there's different courses within Stirling that they are kind of looking at specifically because of how COVID has interfered, if you want to look at it that way, on the normal things, just to see, is that still on track? Is there a hope that for the social work staff that they will be accepted for 2021 on that programme?
So it's highlighted before, Alison, yeah?
Yeah, and apologies, I can't give you an immediate response to that in terms of our applications to the programme for this year. I'm certainly happy to check that out. I suppose in general terms, though, we would always encourage staff to undertake post-qualifying training at that sort of level. And we work closely with our colleagues in training and organisational development to build those links. In relation to the specific question, I can certainly check that. Our experience is that a lot of courses are opening up again. We're beginning to take social work students again. So activity is beginning to open. So I would anticipate that will run. I can't give you an immediate answer to how many people we have linked with that, but I can certainly check that out and update you.
That's great.
Thanks, Alison. You okay with that, Claire?
That's great. And last but not least, about the distress brief intervention.
Yeah.
I think it's marvellous. Really think it's marvellous. Really good to know that North Lanarkshire included 16 and 17-year-olds within this. And is there a reasoning, which I think we all kind of know the answer, but a specific reason of why decided to include 16 and 17-year-olds? And is there kind of an age breakdown of how many have been looked after under this and under each kind of age bracket?
Yeah, there is. Now, I don't have the figures just now, but there is a governance group that oversees this because obviously we were a pilot area. I think the reason in terms of inclusion was both because we were fairly mature as a pilot compared to some of the other areas, and because it was working well for the initial target group. The view was that it would be extended. We did work not only with, I suppose, the services who were initially referring to DBI, so the hospitals, ambulance service, etc. But we did some work with our schools round about that as well in preparation for the expansion to 16 and 17-year-olds. So I think it was a mixture of, there was a national interest in promoting that and testing that out, and we had a local desire to do that in terms of meeting need as well. But Ross may know more of the detail on that than I do, but I think that was very much the picture.
Yeah, Ross?
That's exactly it. It was a sort of twofold thing from the national pilot. They were keen to start to see that expansion. And I think it was the fact that Lanarkshire were seen as the furthest forward, and that's why they commenced it with us first.
Thanks, Ross. And Claire, it's interesting you raised that because it was, as I read that report in detail, page 33, the highest referring agency to the for the use of this is ED, presumably that's your department, Frank, education there, which is obviously young people at 16, 17, and I'm assuming some form of bereavement or something like that they're dealing with. It would have been my intention to bring people like this along, an organisation like this, to do presentations, but under the present context, I don't think presentations are going to put anybody in that situation. But that's one of the positive aspects of the report that comes out there, Claire, among others. Thanks very much. Claire, after Claire, you okay, Claire, with that? Thank you. I've then got Bob. Bob, you hearing us okay this time?
Yeah, it's absolutely perfect now, Tom. Thanks very much. Alison, I'd like to thank Alison and our team for everything they've done. The last 6 months must have been a nightmare for you. But Alison, can you let us know what methods are in place, if any, to protect the vulnerable people that you've got under your care, both in catching or spreading the virus? And if I could have a supplementary after that, Tommy, thank you.
No problem. Alison, the vulnerable within.
Okay, so I suppose if you're talking about the adults where we have particular legal responsibility for, as opposed to adults who may be on guardianship or who we may care for, including in, as you know, we've only got one established residential establishment ourselves. Or whether we work with them in specific services, I suppose we've amended our service model to reduce risk. We, in terms of our interface with adults, clearly we follow advice around the use of PPE and distancing where it's possible. And that's something that we also work on with our providers, including the providers, the supported living providers as well, in terms of supporting them. To be honest, the answer to that question could be hugely multidimensional, because it would include the sort of support that you talked about earlier that was available to shielded groups to reduce the need for adults to, you know, engage and make sure that they get their basic needs met at home without having to go out into the community and expose themselves to risk, you know, against advice. So it's multi-dimensional really. But I suppose in terms of the way our services run and the way we support people, the risk assessment process would very much make sure that we were trying to manage that in a way and manage all the support that we provide in a way that minimised any risk to the adults concerned in relation to infection.
So presumably they become multi-agency, it's not just the social work there. But there's an interesting category there in relation to Bob's question, and it's that category that's been identified that's on the increase of what's called self-harm. It's within the pie chart there, and I noticed that sits at 6% of the referrals we've got. So is that a development from what you would call physical harm into what's now seen as self-neglect, presumably? And they're open to this susceptibility of the COVID.
So I suppose, as noted earlier, the arrangements nationally aren't as mature as they are in child protection, where the categorisation is necessarily quite set in that way, and probably those adults, it could be physical harm, it could be emotional, it usually is physical harm that people are suffering, but not because of physical abuse, and therefore I think we decided ourselves that, given these are some of the most complex situations sometimes legally and to support, because people don't necessarily have insight into their own self-neglect, that it was useful for us to categorise that separately, to give a sense of the sort of challenges that we are working with and that people are living with in the community. So self-neglect could be for a whole range of reasons. It could be to do with someone's capacity and understanding. It could be to do with particular ways of living and choices. but they're not necessarily informed choices, which is why other services have to intervene in terms of living circumstances that leave people open to risk, and it can also link at times to addiction and other issues. But they can be very complex situations to deal with, as you say. So we try and ensure that we support people in those situations as far as possible, and using, you know, respecting their dignity and right to have say over their lives and to make choices, but also being reflective of the fact that we also have duties of care to people, and that sometimes where choices cause them themselves significant harm, we need to intervene if we've got legal ability to do so.
Complex areas there, Bob, but there's a balance between, you know, the rights and the responsibilities and so on and so forth.
Yeah, I understand that, Tommy. That's fine. Alison, page 15, 2.6. Do we have a ballpark figure in the cost factor against an investigation, an internal one?
Apologies, I didn't quite catch that. So 2.6 in the cover report, are you talking about investigation? Yeah. And the cost, did you say?
Yeah, ballpark.
I don't think we have a ballpark figure of the cost of investigations, to be honest, but what we would probably, so we don't cost, because individual investigations may be more or less complex. I think really the cost would come principally from the sort of personnel resource in terms of you know, fulfilling those requirements and the amount of time from the social workers that are dedicated to that. But an investigation could be something that was completed in a day or could take 2 or 3 weeks to complete in terms of progressing through it. So it's difficult to give an absolute figure for that. What I can say to you probably is that the level of activity that is carried out by the service, I suppose, far exceeds maybe what was originally envisaged when the legislation came in 2007. We got some specific funding which allowed us to employ an additional social worker per team to support adult protection activity. I think you can tell from the level of activity that's reflected in the report that actually the resource that goes into it is far more significant than that. But I can't give you a sort of unit cost figure, I'm afraid, for that at this point in time.
Okay, it's hard to quantify it, but it's complex. Okay, Bob, thanks very much. I've got Councillor Davy Baird next. Davy?
Thanks, Karina. It's just a simple question in relation to the adult protection. What measures are being taken to protect older vulnerable members, you know, if they've got dementia, etc., against being targeted by others within the community, especially given the circumstances surrounding COVID?
So presumably, Alison, the report refers to cases, but how about prevention? I noticed that there's various agencies involved.
Yeah, I mean, that would really be something that the Adult Protection Committee would look at, and we would very much do in partnership in terms of safeguarding. We rely on our, not just the, you know, if we're talking about police, but housing and communities, colleagues, community policing as well, to help us identify adult. We obviously know adults who may be vulnerable, but we don't necessarily see everything that's going on in the community or where people may take advantage. So whilst when we're involved, we will have individual measures in place, which can include using assistive technology so that we are aware if maybe someone is entering or exiting a house, and that helps us to keep them safe. We also rely on intelligence from partners and very much working in partnership round about that. So partly it would be about our individual planning. you're right. It's a challenge just now, and sometimes the individuals we're working with aren't necessarily particularly insightful to the risk that they face. But we very much rely on the arrangements with partners, both around individuals and communities, to do that. And all of our normal work. Our Adult Protection Committee has been meeting more regularly during the pandemic period, etc., to make sure we pick up on that sort of intelligence too.
Alison, thanks for that response. David, in relation to your question, if page 33, if you've got it in front of you, refers to the Adult Protection Committee specifically. And Alison, over the page, I noticed that they have to do a biannual report. And the latest one is 2016 to 18. You referred there that they could pick up on prevention measures. Now, there's a reference there that says that report's available on the website, and it says it's available here. But Andrew Rose, I'm talking to you here, that's left vacant. If we could maybe get that connection in, that might be helpful, David. And there's also one further down, because it's multi-agency, where there's a report that's referred to as being able to be accessed, click here, and it's not on the report papers. I don't know if that's just mine. If you could get the access connections there, that might be helpful for Councillor Baird and the rest of us that are interested in the prevention aspect of that.
Convener, if you go to the digital version of the papers, you can click on the link and they'll take you to the council's website where
they can click on that. So it's there, David, if you want to take it on that one.
Thanks, Convener. I would do, but I don't have actually access to my Outlook. I've got problems with that, so I'm trying to get that sorted.
Okay.
It's just in relation, especially with financial aspects for vulnerable people, given the lockdown, the situation, they're not seeing family, friends, etc. Are they more open? So I'd appreciate that. When I get a chance, I'll go and look at that report. Because,
and if you don't mind, Convener,
Alison,
it was just to say one of the points made at the beginning of the report is really some of the work the Adult Protection Committee did, just recognising that vulnerability in the early stages of the pandemic in terms of materials to assist staff to identify and report harm. And there certainly has been, through our comms, also a sort of just an ask of the community in general also to be aware of potential risks and to refer to agencies where appropriate.
Is that quite reassuring, David? Is that quite reassuring?
If Alison could send us any sort of reports or any of the details on that, so we can actually access
that would be great. Thanks, David.
Thank you.
And my apologies, I seem to get this mixed up. And Councillor Weir. Anne, I'm sorry, you should have next in your notes. You've texted me. Sorry about that. Are you there?
You're forgiven, Convener.
Thank you.
It's a question probably for Alison. I'm concerned about the statistics. The first one in page 30 of the report, of the Adult Protection Report. The graph, the last statistic is not known. Why is it not known? What does that mean, not known?
Apologies, that will be a recording issue on our part, and it's something that we're looking at. So our activity tracker, we're working with our localities on. There is sometimes there's a particular, I suppose, expectation that we have around recording on our database and screens, which obviously allows us to then analyse in more detail the referrals and all of and produces the sort of information you're seeing in front of you today. Sometimes, unfortunately, these are not completed as fully as they should be. It's something we continue to work with staff on. So if it's not known, it will be something that's been recorded as a referral, but the primary reason, the screen with the primary reason on it, hasn't been fully completed, and that's why that's there. if we drilled down and looked at the actual case record for those situations, we would be able to see that this pulls it from those screens. And when you're looking at it at the scale we've got, it doesn't allow us to give reasons. So it's a recording issue and something we continue to work on.
Okay.
Sorry, I've got a question, Convener, if you don't
No
mind.
problem, man.
Page 37 of the report, the table.
Yeah.
I'm just concerned. Recorded, not recorded, not recorded. On 3 of the issues, total referrals, investigations, initial case conferences. 19% initial case conferences not recorded. I mean, what does that mean?
Sorry, my numbering slightly different here. So is that the table?
The table, summary of adult protection activity for 2019/20.
Page 37.
Aye, page 37 of 96, it says at the bottom.
Right, okay.
So you've got not recorded, not recorded, not recorded.
So it's page 19 of the actual report.
Thank you. That's a bit,
I didn't
I'm
know you were
sorry,
just
I'm
dealing with
sitting
the
with a
report,
different,
Alison,
yeah,
sorry.
apologies. I'm sitting with that. So yes, so there's 2 different explanations potentially for that. You're right, some of it is, as I said before, a recording issue, and that's you'll note that that's a relatively small proportion. Some of it is the crossover between 2 years. So there can be activity that started in 2019 and 20, but not concluded. But the general issue of not recording is an issue about the overarching tracking information not being recorded, as opposed to there not being sort of case records on these cases. And that's something that, as I said earlier, I appreciate it's not something that we would want it to be 0 really in these, other than when cases crossed over from year to year. But it's something that certainly is taken back by our lead managers and discussed with localities. And it's something that and as I think one of the things that was noted in the report was that we had strengthened our individual service adult protection procedures this year to improve governance, and that includes expectations about recording. So we could drill down on that, and it's not that there has been that there's no record, that you can't pull that simple outcome information, which obviously doesn't help, and I appreciate it. You're right to pick that up as a concern, an area for improvement.
I've just got another question, Convener, if you don't mind. Do you think it's one of the factors is there's too many recording systems? If there was one recording system across the council?
Well, can I seek clarification on that, Alison? When Councillor Weir is asking in that, is the 2% of the original total referrals, anything under that as it comes off, you have to take it off that. They preceded. So the 2% is really 2% of 2,230 cases.
Yes.
Yeah. It makes it a wee bit, that makes it more positive.
No, what I'm concerned about, Convener, is I'm really concerned about people that fall down the cracks, that get forgotten about because it's not recorded, so it gets passed over.
Okay, so I could provide, our audit activity is also there to provide some assurance around about that, and that's where we drill down in more detail in relation to a proportion of those referrals and investigations, and make sure that where recording isn't as strong as it should be, that actually that isn't a reflection on the activity that sits underneath that, and that's still happening. In relation to your question on different systems, the primary system we use for this recording is SWIS, which is our social work information system and database. It is an out-of-date database, and we are exploring at this point in time. It doesn't have the same functionality that some more modern systems have, and that sometimes means that we need, so we've only got one recording system, but in terms of drawing reports, it's not as strong as some of the more modern systems that's supporting us to do that. And it's certainly
Alison, can I ask,
something that we're working
Councillor Weir
on.
has raised it, and I think we're all curious as to this. This 2% really refers to 45 people, you know, that are falling into that category. It's 2% of the 2,230. If we've got a review coming up, which has been pro tem suspended because of COVID, and the Scottish Government is looking at that, I mean, that answer that's been given there, if we can make sure that that is contained within it, because I appreciate the fact that it's been raised, it gives clarity to that situation, and they might well be looking for that and ask the same questions.
No, absolutely, and it's as I say, it's an area. It's whilst the 2% is not huge, when you look at it in the other areas, where we are involved in more intensive activity with adults, you would want that record to be more robust. And whilst the activity is happening, you would want to be able to report on that more effectively. So absolutely an area we're looking at, but in terms of strengthening, having a stronger database that supports our practitioners and our reporting, that's certainly something that we're exploring as a service, as well as something that would be helpful going forward.
Thanks for raising that, Anne. Is that?
Thank you, convener. That's me. Thank you.
Progress and develop. And I now have Sandy, Councillor Watson, on my list here. Is that right?
That's right. Thank you, convener. Sorry for going in twice, but my chat got compacted, so I wasn't sure whether I was in or I wasn't in. First of all, well done, Ross and Alison and teams over the last 6 months. Sterling work in really difficult circumstances. And I just dig a bit deeper on a point that David Baird made on page 30, when we talk about the investigations, particularly on financial harm. 25% of investigations progressed, initial case conference, with financial harm being the highest reason. Now, I would just dig a wee bit, what is this financial harm? Is it basically fraud on the phone? Or is it trusted friends who are proving to be deceitful? Because really, it is quite disgusting that anybody would take advantage of a situation where they can take money by cheating like that. And I would like to delve into a wee bit more and see exactly where we're going with this.
Absolutely, Sandy. If Alison, if you could develop that.
So I suppose in relation to your question, Councillor Watson, it tends not to be, so if an adult suffers a one-off sort of telephone fraud or less likely to be online fraud, that's may well be investigated by the appropriate authorities, but unless they also make the sequel test, wouldn't be something that was done through adult protection procedures. You're right that the financial harm that, from a social work perspective, we tend to get involved investigating is more what we would call financial exploitation, not rather than pure fraud. So where someone is being targeted either externally by someone in the community, or where family members potentially are misappropriating money, we're concerned about financial harm to an adult who meets the 3-point test and is vulnerable. And the reason that, although it's not the highest, I suppose, reason for the referral in terms of categorisation, that it goes to, it's highly represented in the cases that are going to case conference, because a little bit like the self-neglect situations, those situations tend to be highly complex and quite difficult to unpick and investigate. It's something we involve our police colleagues with, but in relation to developing our procedures round about that we have also developed relationships with banks, etc., and done work with other financial institutions that help spot financial harm, including with our own financial inclusion teams, etc., and trying to promote arrangements, including, that protect people from financial harm. But yes, it's financial exploitation, usually by people either within the community or within that adult's network. that are the situations that we're talking about here in that category.
Sandy? Yeah. Sandy?
Thanks, that's okay.
Okay.
Thank you.
An interesting question, an interesting response. A worrying one. Thanks, Sandy. I don't see any more names in front of me, but besides categorisation, and I appreciate the analysis that's went into reading the whole report, Alison, you might know of the detailed report in front of you, but this question has to be asked because I didn't ask it at the conveners. It says that during lockdown, our senior officers have been trying to keep in contact with people that fall into this category. And then in the report, it admits that with distance meetings, I'm reading from the report, it says that there's various multi-agencies are attending these meetings. But unfortunately, the clients are not turning up. Now, how are we addressing that vital situation? These might be people who don't have access to it. Is that being addressed? Because it's pointless when the consultation's going on, where there's meetings been set up and the individual, the adults, are not attending the actual virtual meeting.
Yeah, and so this is a sort of wider issue for us within social work in terms of arrangements going forward. So in terms of the sort of arrangement and the platforms we're using just now, sometimes it does promote attendance from key partners. It takes less time for people to come into meetings. It's easier for them to link in from a range of different places. So we have had through our virtual meeting platforms, and this is not just in adult protection, across the whole of social work, good engagement for partners, and to a certain extent it has, I suppose, that engagement supports good planning and decision making. But we do have concerns about not only vulnerable adults, but some other people whose situations mean that it is difficult, as you say, for them to either use technology, or where if you are engaging with them virtually, you might not be able to see what else is going on within the house. You might not be able to see if someone else is influencing them, or what they're saying within a meeting setting. And therefore we acknowledge that it's not, and it can also be quite difficult for an adult, particularly someone who's got cognitive difficulties, to engage through this sort of platform. So what we don't want is, as far as possible, to exclude people from being able to participate in decisions. So either at the moment we're having to have discussion with the adult out with and feed in views, or we're exploring as part of our recovery plan the option of having hybrid meetings where, rather than bringing a big group of people together, that potentially a worker and the adult, or a trusted support worker from another agency is with the adult in a particular venue, distanced, if that's appropriate, or with appropriate PPE, and we help them engage through that. So they can be, so some participants in the meeting might be virtual, but we can have people supported by a couple of key people in the same room where that's appropriate as well. So we're testing those things out, and certainly we're acknowledging in social work generally, particularly when we're dealing with sensitive issues and there are complex dynamics between people, that sometimes nothing entirely replaces a sort of face-to-face contact. So we're trying to look at how hybrid meetings will work and what's right for individuals. So some of our service users actually like virtual meetings. It gives them a little bit of distance. They're more confident engaging in that way, but for some of our service users that doesn't work at all. So we don't have all of the answers as yet, but we're trying to be as flexible as possible to maximise participation.
The reason I flag it up at this stage is there's so much excellent analysis. It's only right, because this is a classic case. These are what's called in the report adults at risk. These are, the main ones. But if it's being worked on, next year's report no doubt will contain the solution to get the people directly involved I know the restrictions, distancing and so on and so forth. But it's good that the agencies are ticking boxes and getting round a screen anyway. Thanks very much for that, Alison. It's been, I think that was an excellent analysis of a report that's sometimes just noted, and I think it's just the present climate that's got us looking, understandably so, with more attention to these. If we can agree to note that report, then that would take us on to the next one, which is obviously connected and correlated to some of the discussions we've been having so far. As a committee, we've had the intention of redesigning the home support section, and I never thought I would say this, but thank God for technology, because if it hadn't been for technology, you can imagine the problem departments, not least the way home support was being redesigned. So, Morag, if you just take us through the report, say that the technology has been a good development and how the rest of it is going to develop throughout the year.
Okay, thank you, Convener. There have been many papers on the home support redesign come through committee, so this one is coming to update on what's described as phase 2 of the home support redesign, and obviously as we've been discussing, this has coincided with COVID, so the paper provides an update on where we've got to with phase 2, but also the adjustments that have been made as a result of also responding to the pandemic. Home support is one of the biggest council services, 1,300 staff. They can see up to 5,500 people a year, and the intention of the redesign was very much to increase the efficiency and the effectiveness of the service to an extent through electronic scheduling, but also just through different structures, and to better respond to the increased pressure on the service as a result of demographic changes, where we know that there are more older people, but there are also more people living longer with a greater impact on their independence and ability. So the work that's been done in phase 2 was introducing a new structure which was designed to be kind of cleaner and leaner in relation to the layers of responsibility, with a focus very much on people having more direct contact with service users, in obviously providing the service, but also in checking the quality, and to plan and support in a kind of more focused home and rehabilitation and recovery. Staff, despite the pandemic, have moved to their new roles and been appointed to their new roles, and now the service is staffed at all management levels from 7 o'clock in the morning until 7 o'clock at night, 7 days. And the work that's been done to support the new roles and the introduction to people into these new roles around training has looked a bit different. So we got a couple of training sessions in before that had to change focus, but there's been an opportunity to redesign some of the training into remote, and that will continue to be done. Probably the biggest change is that in conjunction with the different roles, centralising the home support service coordinators and service delivery managers into the one location in the DL building has been halted. So we did start, and some staff have moved into that location, but really the focus has been on having a rota of a small number of people in at a time, so that the participants in that location change over the days and weeks and months, so that people get a chance to link with each other, but that's supported very much by remote working. So the development of NetCall has been sped on hugely through the pandemic and has allowed the flow of calls and the management of work to be really quite seamless in relation to people working in the DL building and working at home and working in other locations. So the development of that has been very significant. Dynamic scheduling is continuing, and we hope that the kind of testing of that will be December-ish this year. The next steps for the home support redesign are about tendering for home support services, the review of the rotas, further development of dynamic scheduling, and a continued link into the work around first point of contact and the integrated rehab teams. So lots of great work being done during the period, and certainly the development of the structure has felt like a bit of a challenge to begin with, but it was the right thing to do and has supported the service to be strong through a difficult period, where you'll see that there has been, through negotiations with families, some reduction in footfall in people's homes, but the service has been maintained at a high level throughout COVID, and really we're now back up at pre-COVID levels in terms of provision.
Amazing. Thanks very much. Thanks very much, Maureen. It's amazing when you consider I took over from Pat as the convener, and we promised regular reports on this. It's amazing how far we've come over such a short period of time, and little did we realise COVID was going to hit us, and yet we're back to where we originally planned to be, and we're now at stage 2. So there's questions here based on the report. I have them in order: Councillor Cameron, Councillor Baird and Councillor McGowan. So Colin, I'll call myself first.
Thank you, convener. Right, well, can I first of all say thank you for the report, and comparing it to some of them in the past, as was promised, we were going to get much more clarity in the reports to allow to allow us councillors that aren't quite as technically minded to be able to go through them better. And I must say, this one is the best one yet. So saying that, I've got a couple of questions and a point I'd like to raise.
No problem.
Right, first issue is page 42 of the papers, which is point 2.4, basically looking at the staff that volunteered to move across to assist during the COVID. It looks like there's only a 20% retention rate. Now, I can see the various reasons for them dropping out, and none of them are I can understand all of them, but with us going down to the 20% rate, and with 5 of them dropping off after full training, I was wondering if it might have been an idea to, and going forward, if it might be an idea to have somebody that's actually at the front line carer to speak to people at the very early stages so that they know what to expect. Because while councillors and our staff may have caring responsibilities within the family, it's not quite the same as going into somebody's home and assisting a stranger. So it might be worth having some sort of contact between a frontline worker and I don't know if this was the case, but it might be as well having some contact between a frontline worker and one of these voluntary transfers before they move ahead, so they can know what to expect. The next issue I was going to raise is actually, well, it's in two parts of the report, because it's 2 versions of the same graph, just a time differential. It's if you go to page 45, and you look at the home workers' absence statistics. Now, I think I've worked it out because I've went onto the online graph and got the coloured graph here. What I'm quite happy with is we've actually been given written figures. Now, that's brilliant. And they work out for the suspension of service users. But when you actually go with the figures and the plotted graph for home support workers' absence statistics, they don't actually line up. When you go on to the actual coloured graph, you can see that the highest peak there is for other absences, not sicknesses, which, given that it's for like June, etc., I'm presuming that's people on holiday. But the actual figure we've got for total absences doesn't equate to the total for the graph. It looks like the holiday absences haven't been included with that figure. So can I ask that in future, either the holiday absences are added into that figure, or the holiday absences are removed from the graph, either or, because it's not actually helpful to have one figure written and then a different one on the graph when you're looking at it and you're going, well, that looks almost double.
Well, first of all, I would say I'm glad that these graphs are here, because Bob Burgess asked earlier on, and I knew they were in the paper somewhere, but this is the one that Bob was asking about, the absences, which might be more complex than I think the citations might be mutually exclusive, but I'll get the officer to clarify that. But with your permission, let's go back and get the first part clarified, and then we'll come to the more complicated situation of the two graphs on page 45. Morag, can you clarify there the potential to have a sort of taster exercise in advance that might see a less dropout, albeit that this was done under an accelerated programme?
Yeah, I suppose the information on page 42 in relation to the work that was done to utilise the offer of staff who might not be used in their usual role, but might support home support. Obviously, that it was at a very unusual time, and I think that the dropout rate wouldn't reflect what we would do if we were just straightforwardly recruiting to that kind of role, and certainly not recruiting in more normal times. The opportunity to speak to people who are undertaking the role is often done, and certainly through recruitment, particularly large-scale recruitment, we would generally do that. And through training and induction, the opportunity to shadow staff was also done. I think probably what that reflects is that people made an active or informed choice that the role wasn't right for them. So whilst it doesn't look particularly positive in relation to the success, as a service, we would much rather not have people that aren't comfortable with providing that role doing it.
So, I think that's clarified. Unique circumstances of the time, would you accept that okay, Colin?
Yes, I completely accept that, and I knew that before asking the question. It is a complete unique happening. It was just with the 20% retention rate, and I'm delighted that so many staff volunteered in the first place. Don't misunderstand me. It was just what we could do to retain more,
as well as the volunteering of families to actually become the to take on the role themselves. However, we'll come to them now, and we'll come to them later. Can we turn now more out to the? It's a difficult thing to do, I know, because there may well be a mutual exclusivity between the two graphs. There may well be correlations. But can we try and simplify? Is there something in there that can be made more clear than it's presently being presented?
Yeah, I'm happy to look at the information and represent it in a different way. I think that the point is well made about separating out holidays as a reason for absence rather than the other reasons that are given there. And obviously, as we analyse information in more detail, the kind of variation in the people supported over the months since the beginning of lockdown will be available as well. I think maybe that rather than have the answer right now, that probably...
Colin, would you be prepared, because we'll be back with a stage 2 update in 3 months' time, would you be prepared to accept what Morag said there, and we'll come back with that further explanation and breakdown in 3 months' time, because it will continue from April onwards?
Yeah, that's fine, but to be honest, all it really needs is seeing 2.14 is just see an extra line that says, and this many people are on non-sickness absence, and then the total figures add up for the graph. That was the main point I was making.
Yeah.
That would literally clarify it, one line.
Yeah, we can make sure that's included, and it brings balance. It's positive balance then, Morag.
Yeah, that's fine. Yeah.
Okay. You okay with that, Colin? I can move on now?
Yeah, that's brilliant. Thank you very much.
Thank you. Davy, Councillor Baird.
Hey, thanks, convener. I know it's a very detailed report, so maybe the information I'm looking for is contained within it. But what I would ask is, what lessons have been learned in relation to the service delivery for the end user in phase 1, which has now been carried over into phase 2? are implemented in phase 2?
I suppose the one of the main thrusts of the reason for the change in structure was to make sure that there was increased opportunity to check the quality, to support frontline staff, and to ensure that people were getting the service the way that they were looking for it. So often we know that people have had comments about the time that services are available and the focus on activity. So I think in reflection, we are confident that the change in structure and the induction of people into their new roles will do that. I think what I would want over time is to see more evidence that that is actually increasing the levels of satisfaction with people and supporting people with complex need to remain confidently at home. But the future performance information will do that.
Thanks, Maura. David, I mean, I have to say that from an Airdrie North perspective, I wasn't getting any adverse comments, but we've started to transfer, you know, so there is something that we'll probably benefit from once Airdrie. I mean, I saw the phasing as more of a sort of logistical exercise. So we've learned that we'll need more space. That's one thing more, obviously. And I'm assuming that DL has now been custom built for the flood that's ready to hit us.
Well, the DL building is still the focus of the centralised arrangement, but where in the past it would have had about 110 staff located there, they're located there remotely, if you like. So in principle, they're working together, but they're doing that remotely. So the opportunity for people to use video conferencing, to use different ways of linking with each other, has been speedily developed as well, but obviously it will be developed further, and that's really why a rota system for who's present in the DL building and having the kind of physical opportunity to link with each other as well as doing that remotely is rotating so that everybody gets the chance to do that.
Yeah, we're not there yet, but we'll all get there. And
Yeah.
You okay with that, David? No, not responding. I'm assuming that the silence here is agreement, and that been the case. Are you okay, David?
I just wanted to roll it back, Tommy.
Yeah, sure.
Going back to what Morag was saying. So what is the basic benchmark for this then? You know, again, going back to the point Councillor Weir made earlier about compare and contrast. There must be a bench line from where we are now to where we want to be.
Morag?
And yes, in relation to, I suppose in relation to performance, what we would like to see is a kind of more, a more joined up arrangement for individual people where they've got fewer people through their door, they've got the times that they want. So I suppose going back to that comment about satisfaction levels in relation to what was the design of support and what was the provision that we would want to see performance over time that sees evidence that that's increasingly the experience for people who receive home support services.
And that's summarised in the measures of success at the very end. Not least is planning for earlier hospital discharge. I think we'd all agree with that. You okay with that then, David? You've obviously got problems. Right, David, I've seen your sign there. Thanks very much. And I think Annie, Councillor Weir, let you in again there. It's either Councillor Weir or Councillor McGowan. But Annie, I'll overlook you the last time, so on you go and beat Agnes in. Jan?
I'm getting in before Aggie.
Okay.
My question was actually covered almost completely by Colin's question. What I wanted to say was I know it's unusual times. I wanted to ask, is there going to be more scrutiny with regard to selecting people to do the training? Because that's a huge attrition rate. And I'm looking at the costs. You know, you've trained them and then you get to the end and they go, no, I don't want to do the job. Whereas at the very start, you could, you know, use your that period to weed them out a wee bit more?
Summarised as changing culture, changing times. So if we change the evaluation process, Morag.
Aye, that's what I'm looking for.
Yeah.
I just, as I said before, I think the difference between doing selection processes the way that we would normally by advertising and interviewing and then seeking references is obviously what we would normally do. COVID meant that we had the opportunity to consider staff who themselves hadn't been looking to work in home support. It came up because of the circumstances of COVID, which is quite different. Yeah. I think in reality, through the selection process, people realised how complex some older adults are to support in the community, and that's not what they had expected out of home support, which is a wee bit different from people who would look for that kind of employment and know what they were likely to be going into. So I wouldn't want the attrition rate in that arrangement particularly to make you feel less confident about our selection process usually, because that was an unusual thing to do.
Okay, you okay with that, Annie?
Yes, thank you.
Thank you. Now, Agnes, yourself.
I don't mind my pal Anne going first.
I'm going to keep him with the two of you.
No, I just got to say it's such a crucial service that I'm delighted to see that all the new technology has been used to make it as efficient as it possibly can be. Because you know, one of the problems with, or one of the parts of home support is that the home support workers can't tell how long they're going to be in each house, and they don't want to make somebody feel that they're rushing. So my mother stayed with me for a while with home support workers coming, and sometimes they would be 10 minutes, 15 minutes late. And when they came to the door, they looked really worried. They'd come to the door really worried. I'm really sorry, I'm late. I said, no, I understand that the previous person is obviously, and they said, oh, thank goodness that you understand, because we get into terrible rows and we're late and people are really stressed, and it causes a lot of stress when people are, arrive late. So with this dynamic scheduling, it means that they can keep in touch with the base to say they've been held up, they're going to be a bit late. And I think that's an enormous thing and will lower stress in the people that are and
absolutely.
Really, I think it's amazing that in the actual job advert there was 211 expressions of interest for actual jobs. I think that shows that people are really interested in this job. Absolutely. I just want to ask that there was 837 service users suspended all or part of their services at the time of COVID. When they suspended, was there still a check that these people were getting the right level of care? Because much as their family love them, their family are not trained, obviously, in a lot of the work that these home support workers do. So was there still a check that these people were getting the level of service that they got previously?
Thanks, Agnes. Excellent question. Morag, could you clarify that? It's an interesting point.
Yep, so the suspension of service was obviously done in communication and discussion with people in the first place, and the staff adopted a red, amber, green process to the level of confidence that that arrangement would be sustained, and made contact accordingly. So if somebody was red or amber, they would make contact much more frequently than people that they were more sure that the arrangement would work. And obviously people know the contact arrangements anyway, and with NetCall the confidence that the call would be answered was greater, so people were still able to make contact with services in a fairly seamless way. So there was an opportunity both ways round, where family members, if they realised that actually it's not something that they could sustain, or the service user thought that, then they could make that approach to us, as well as we did it proactively against a kind of an assumed level of vulnerability.
Excellent. And
thank you very much.
Thanks, Agnes, for the points. And I do concur with you that the concerns we had about, the too rigid situation whereby the client is coming last, dynamic scheduling, Morag, is Is that coming across as universally throughout, a bit of flexibility where the client has been seen as the main one there?
Yeah, I mean, I suppose the whole focus of the change is about ensuring that we've got a very person-centred approach to the service. The call system in terms of net call is fairly well embedded now. Dynamic scheduling needs a bit more work, so it's not up and running. So people are using the same kind of methods as previously, but actually what that's done is allow a step change to a different service into the future.
Well, Nick, certainly been well tested. It's been a baptism of fire, and it's survived. So thanks for those questions, Agnes. If that's okay with yourself, we'll now move on to the only one I've got left for this one is Claire.
Okay, thanks, Kavina, and you'll be overjoyed to know that all my questions have been answered. So I've got nothing to add. Thank you.
That's great, Claire, and answered hopefully with positive outcomes. Thank you. That being the case then, folks, again, I gave an assurance we would be taking each time along. I know it's pedestrian, but at each stage as that transfer took place on the home support service, a report will be here in front of us, and I'll take on board the comments that have been made today. If we can agree to that one, can we move on to the next item on the agenda, item 5, which, Ross, are you taking us through this one? I know you spoke to the conveners. Okay, thank you. It's
Thanks, convener.
Budget decision for the community alarm service. Thank you.
Sorry, thanks, convener. So, following the decision at Council in February in terms of the budget decision to introduce the charge, at the IGB in March of this year, we decided to put a delay on the implementation of the community alarm charge, simply because of the fact we didn't have the administrative capacity to put it in place due to all the work ongoing around COVID. Since then, we have commenced the work. You'll remember that we were one of 2 local authority areas in Scotland, ourselves and Orkney, that didn't have an alarm charge, and the council decision was to bring in a charge that was equal to the average for Scotland. So at the end of August, we were putting out the patient letters, our service user letters, to identify the fact that we were introducing a charge. And what we have done is try our best to learn as much as possible from the 2016 exercise. So we staggered the letters that went out to service users to try our best to control the demand that would come through from those letters. We sent out a briefing to all elected members on the 21st of August. We set up a dedicated phone line. And again, building on that learning from 2016, we increased the capacity of it and also increased the capacity for week 1 when we expected to get the greatest demand. We have focused on individual assessments. So for anybody getting in contact, we've got a dedicated phone line, obviously there for that process, but we are able to give then an individual assessment and also undertake benefits maximisation for those individuals. In terms of collections, the fact that COVID is with us and we need to try best to reduce footfall onto sites, that's proved a bit of a challenge. So we have gone through a process to identify a different process for collections, giving people the option to either post it into us or do drop-offs at sites that don't need a physical handover with an individual. And just to give you an update, so far we've had 1,388 queries through the phone line. We've had 891 service users who were looking to stop their service. Only 14% of those were because they didn't want to pay, and 42% were just people who had never actually used it, so they had an alarm but they'd never actually had any need to use it. And we've also had 164 financial assessment forms received through the process. So we're working our way through that, and we're working our way through that process now, and we'll continue that over the coming weeks. But I suppose it's just important for committee to understand the fact that, well, for people who are feeling that they are unable to pay for it, we will undertake an individual assessment for each one as part of that process.
That's the crucial point. That income maximisation analysis will be done. Thanks, Ross. Ross, can you clarify, did all members get that briefing note on the 21st of August? Some members were saying they hadn't seen it.
Yeah, I can confirm it was sent out by Stephen Penman on 21st of August to all members.
Okay, so colleagues.
Sorry, just to say, if anybody hasn't received it, please let me know, and we'll make sure we get a reissued copy out to people.
Right. Okay. Who would you have here? I've got Councillor Cameron. Colin.
Sorry there, I was trying to use the space bar thing to unmute.
That's
and I
okay.
ended up accidentally sending a load of space bars to the text. Right. What it is I've been contacted by a couple of constituents, literally a couple of couples, that have received the letter about the charges for the community alarm service, and in the cases of them, all the both people in the couple are vulnerable and both use the alarm service. They were looking to find out that they wouldn't be charged twice, because it doesn't make clear in the letter that it's only per base station. So I'm just looking to 100% clarify that. It's my belief that that is the case, but I was just wanting to 100% clarify that, so I can now go back to them and tell them they don't need to worry about being charged twice.
Colin, I'm glad you raised it, because they thought I was being pedantic when the letter says all households. Originally, we had all individuals there. But you want to confirm that, Ross?
No, just exactly that. It's per household, so happy to confirm.
Okay, you okay with that, Colin?
Yes, thank you. It's just, to be perfectly honest, for clarity, it might have been better to say per base station or something along those lines. But as the letters are already out, it allows me to go back and clarify it for them.
Yeah, we picked up on it earlier. The word households in the first line is the clarity there, and you can explain that. And we'll look at ways of making that further clearer for future, the next batch it's sent out. Thanks, Colin, for raising it. Claire?
Thanks, convener. As you know, I mean, when it comes to the community alarms, we would have really liked to have been able to extend the length of time that the alarms were being kept because of the COVID situation, but this wasn't the forum and we weren't allowed to do it. But I do have a concern, a wee bit that Ross, you've alleviated, but it's the number of folk who were estimated that they would hand them back. And it's obviously because of the COVID being so fluid and it being another vulnerable part of the community who were more likely to be shielding, to make sure that when these people are contacting yourselves, that they would be assessed, which you're saying that they are being, they would be assessed to make sure that they're not then going to fall into a gap if, because of COVID specifically, that we go back into another lockdown situation, and that not only have they lost their personal alarms, but they're back into this gap. It's good to know that when they're coming on, you're looking at benefit maximisation, but it's also to ensure that it's looking at the social work situation as well, to see how vulnerable these people are, and if that there's other things that can be put in place to allow them to stay in their own home.
None of us want to be here, but financially this one was forced on us. It was a difficult one that we took earlier in the year, and it's a budget decision. But what I would say is the staffing and the suitability of the system is dependent on getting revenue in this. But you raised issues of those it's the most difficult to reach and those most vulnerable. So I'll seek clarification on that, because you're right, there should be a correlation. We use that phrase used earlier. Nobody slips through the grill on any particular issue. Ross, could we clarify?
Yeah, I mean, I think Alison probably picked this one up earlier in terms of the shielding individuals, where we have been able to identify through the social work system all those individuals. And through this process that we are, if anybody is looking to hand back their alarm, we are looking into whether or not they have used the alarm before, etc. And members will remember through the redesign of the community alarm service previously, we have identified and introduced a sort of needs assessment process that now forms part of a complex assessment that's undertaken to identify, whereby in previous times it was just age-based rather than needs-based. So there are a number of people who have had a community alarm for a number of years who have never actually made use of it, and are, you know, when a charge is introduced, they say, well, actually, I don't want it any longer, because of the fact it's not something I actually use. So there's that sort of differential as well that's possibly coming through, but we are doing a check in terms of, for every individual that is contacting us, how it's been used before, how often it's been used, and then what assessments and support we can put in place instead.
Right, Ross, thanks for that answer, but Claire, can I come back to you? You'll notice that one of the recommendations says there will be a follow-up report to this. So based on what every one of us would make that point, the most vulnerable, whether it's financial, whether it's their house situation, isolation, children, whatever. Ross, logistically, it is possible that the next cycle could bring us back a pro-tem report on that in progress. Is that possible for the next cycle of meetings, which is in 3 months' time, obviously, that would give us and address those issues that we're picking up, such as Claire highlighted there?
Absolutely, we've got a process where we're mapping out every single call and every service use that's made contacts. We'll be able to give an overall update report that sets out exactly the actions we've taken across the board, and we're categorising that as we take it forward just now.
Convener, I appreciate that. To be honest, as I've said before, the quality of the reports that are coming through to this committee are really excellent, and I do appreciate the fact that when we ask for the information is coming through to us. So yes, thank you for that.
Really appreciate that, Claire, and the officers will certainly appreciate that as well. And I've always said the officers work hard in putting reports. It's great when members take the time to read them and give them feedback at situations such as this. Once every 3 months we go over this in detail. I'm quite sure officers would rather we do positive critiques rather than just note things and nod them through it. So I appreciate your comments.
Convener, sorry.
I've got one more up here. I think I've got Geraldine Woods, is that right? Councillor Woods? No?
Convener, it's Alison here. Can I just make one further comment?
Alison, certainly.
Just in terms of reassurance, to follow up what Ross was said there about the process when people are saying that they want to give up their alarms. Absolutely right. We're checking everybody's history of use. So far in doing that, we've identified maybe only half a dozen people who we think need more detailed assessment, and we need further reassurance on before we progress with that. So the checks are already, I suppose could just give you that assurance, identifying whether there is a pattern or other information that we hold that suggests that might be significantly detrimental or unsafe for an individual, then we are exploring that further. But it's a small proportion of those that we've been able to check so far through that process. It's quite a small proportion where we're in those circumstances are arising.
Thanks for that, Alison. It's almost like a filtering system as we go through each stage, and it reaches the very few numbers. But even one is just as important as 100.
I can read it. Can you hear me?
Colleagues, sorry. Oh, Geraldine, yeah.
I can you hear me? I do apologise because I'm doing it for my work, so
no, it's no
I don't want to put a camera on my big mask on my face. I just wanted to ask Ross a couple of questions on the paper. 1.7, it does say on it that in 2016 there was no solution to remove the alarms. So what is the solution now? And I know you were saying, Convener, that the papers are going to come the next time, but what charge will this cost? And does this come out the housing budget?
Ross, I think it was a technical issue the first time round, wasn't it?
Yeah, I mean, I think they come up with a solution this time where we can actually now remove the alarm from individual tenancies, so that there's no longer the requirement to to continue that on. Alison, I don't know if you've got the absolute detail in terms of what that meant, or Morag.
It was specifically, I remember, it was related to sheltered housing complexes.
It was.
Wasn't it? Yeah.
Yeah. So the apologies, if I missed the exact thread of the question, but in terms of sheltered housing, the previous time there was an issue about being able to isolate alarms as opposed to being linked to the full complex. That's no longer an issue. So people in sheltered housing are being treated in the same way as all other service users in relation to the arrangements and the choices.
That was the first part of the question. Thanks for that, Alison. The second part was financial. Am I right in saying that this comes through various agencies? We've got DWP, we've got various individuals, but does it all come back to the social work account, Ross?
So in terms of the financial position on this, well, I think previously, there'd been discussions in 2016 around housing benefit, etc., and whether or not that it should form part of that discussion. This time round, we're basically just undertaking a full benefits maximisation check for anybody who makes contact with us. So that's been offered out. The packs that have gone out to all service users have included the forms that can be completed and sent in, or they can drop a note through the phone line or an email into the system to be contacted by an officer, so that we can undertake that assessment process. So we've increased the capacity around that to be able to meet the needs of obviously expecting a higher demand over the next few weeks from that process. I don't know if that was answers the question, or I've missed the point.
Geraldine?
Well, I don't think it's going to ask the question, but there's another question I would like to ask, Convener. Is that okay?
But what part of the question, isn't it? But yeah. Is it what account that money goes into? Is that the point?
Because I mean, a lot of the community alarms, as you know, a lot of them are in shelter housing, and as you know, shelter housing now, some of it is at amenity and some of it is now mainstream. So I'm just asking, I mean, with these community alarms, is this now coming out now the housing budget, or is it? That's the kind of question I'm asking.
Okay. No. Convener, it's Alison. I can probably answer that again and say that we did explore with housing colleagues the best way for sheltered housing tenants in particular in terms of implementing the charge, and whether or not that should be done in a way which wrapped it up with other rent and other charges. That wasn't seen as appropriate because of just the issue that's been raised about the accounts and about the difference in terms of what's funded via HRA, etc. So it was after that consultation, both with finance and housing colleagues, that the decision was made not to wrap it up with any other charges and very distinctly and separately keep the community alarm charge separate, and it will come in to an account within the service, therefore, as opposed to link with housing.
But Alison, has that specifically clarified at this time, Geraldine?
Yes, Convener, but I've got another question to ask.
Yeah, no problem. Yeah, no, but I just didn't want to go over that. No problem. No, part. Yep, on you go.
That's fine. 3.2, the lead assessment. I mean, what does this involve, and who's making this assessment? I mean, I'm trying to make a wee bit example here. There's issues coming up. As you know, in the past 2 years, we've got James Dempsey's gardens. This is an example in James Dempsey Court. One still got a warden, another hasn't. And I mean, the James Dempsey Court are now saying that for the past 2 years, they've not even had an assessment from obviously the warden and amenity. So I just really want to know how this lead assessment is getting done and who's making the assessments.
Ross, so I see the quality impact assessment. I thought it was an income there, but could you answer?
I'm not 100% sure I'm following the thread. I don't know, Alison, if you're closer to that than me. I'm not. I mean, we undertook an equality impact assessment, obviously, as part of the budget saving, to have a look at how we could mitigate any impact. But I'm not. I'm not clear in terms of the question.
Geraldine?
Yeah, so I'm asking, what does this involve? Because like probably other councillors, I've had emails for tenants. I mean, they're actually phoning up and they're asking the tenant, do you want this community alarm or you don't want it? And they're not even been asked if they want a lead assessment. So I'm asking who's involved in this and who's making the assessment?
Well, we're getting the documentation to complete. Ross?
Yeah, on you go, Alison.
So I think there's potentially two things being confused here. The sort of equality impact assessment is the assessment that we do when there's a policy change, and obviously looks at whether there is a disproportionate impact on certain groups of people, and in particular groups of people with protected characteristics. So that's more around, it's a wider strategic assessment that looks around the policy and any, if it does have a disproportionate impact, any mitigating measures that we need to put in place. That's separate from individual assessment. And what we're offering there is we're required to do an updated assessment on an individual, but very specifically to do a financial assessment to ensure that income's maximised. So it's the difference between what we offer to individual service users and the process that takes place when we're changing a policy.
Has that clarified it, Geraldine? If there is confusion here, it's understandable. That paragraph appears in every report for every council report is the EIA, the equality. It's under our risk procedure. But on the individual, I mean, they should be getting information out how to complete, which I would hope is not too difficult or onerous a task for them to be evaluated.
Councillor Morgan, sorry, just maybe to say again, maybe the confusion here is that the financial assessment is one of the mitigating measures to ensure that there isn't a disproportionate impact on vulnerable groups. So in relation to that, we know that from our helpline, some people have been a little bit confused because we've sent out a financial assessment form to everybody. People aren't obliged to fill that in. But if they want support to ensure that their income's maximised, and our helpline have had calls about that, we explain to people how to do that, and then that's followed up by our financial inclusion service to make sure everybody has support and that their benefits are maximised. So I can understand, because it's a mitigating measure, it's maybe got muddled up with the equality impact assessment. We've
probably
had,
because
I think, maybe
they circulated it.
Yeah,
they circulated it universally rather than selectively, and
yes, so
that was the best way.
Yeah, to give everybody the opportunity, and I think we had about 170, 180 people who have already requested that financial assessment, and we're progressing that.
Is that okay, Geraldine, this time?
Yeah, that's fine.
Right. Is there anyone else got any points to seek clarification on the report?
Convener, Councillor Bartley's looking to come back in.
Councillor Bartley, Claire, sorry.
Sorry, Tommy, just to clarify, just something you said there, Alison. So if somebody phones and says that they want it to be removed, will there automatically be an impact assessment done on that person? Is what I'm wanting to make sure is that there's somebody, as we know our elderly, the vast majority of them are very, very proud, and they're trying to sometimes persuade them to do things like a financial assessment or to admit that they maybe need a wee bit more help or support can be a wee bit more difficult. And I'm preaching to the converted. You know that. This is where you're working in this. But it's to ensure that if somebody contacts the helpline and says, I want to get rid of my alarm, that there will be follow-up done on them to make sure that they are not really, really vulnerable and that they will fall into that gap.
Alison, I see 3.2 there has got the last part, the last sentence that might address that, but there might be more to add.
It really references the process that Ross spoke and I spoke about earlier, to be honest, that this, whilst we can't guarantee, you know, so not, we don't have the capacity or, you know, to go and do a visit to everybody and do a completely fresh assessment of everybody, but we've got, you know, we have our staff who are on the helpline are skilled, they talk through it with people. They also they offer the financial assessment to support people if they are concerned about affordability. And the other checks we talked about is clearly we will check the history and the usage, and if there is a concern that someone who clearly does use the alarm on a regular basis is saying they don't want it, we would in that instance do further assessment of their wider circumstances before following through on that. But some people, you know, have the capacity and are able to make an informed decision, and their relatives are making that when they say they want to withdraw, and we need to accept that. So it's reasonable checks, we think, to try and offer that assurance.
Yeah, it's in there at 3.2, Claire. I mean, just that last sentence where it says anyone withdrawing from the service will be offered a needs-led assessment. But I know where you're coming from and saying, well, that's okay to put that in there for needs-led. But that actually broadens it out away from just finance. So is that reassuring that particular?
No, I'm fine. Alison has clarified that perfectly. Thank you.
Great. Thanks to the officers for clarifying those points in a very sensitive area that it's only but right we give it the attention. And now we'll move on, if we can agree to those recommendations, and we'll move on to item 6 on page 67. Is it Rossi yourself that's taking us through, or is it?
It's Morag.
Morag, sorry.
Thank you, Convener. So the next item is the performance report, which is a standard report which comes to you every quarter. This time the information is covering Q4, which is the 1st of January to the 31st of March this year. Our usual way of reporting on this is to not talk through the whole lot, but to look particularly at the elements which are amber or red. I suppose the comment that I would make about this report is that it sits just immediately before COVID, so some of the information which will be reported now will look a wee bit different. So I'll just maybe whiz through this in relation to the balance of care, which has over the last 5 or 6 quarters just changed slightly, and we will be looking at that, particularly in reflecting the experience of COVID into that. The integrated equipment and adaptation service and the reporting on deliveries within 7 working days is another area which sits in amber, and the service manages the delivery of equipment within an area of really high demand. So the demand is particularly complex to manage and not really something the equipment service itself can control. But it's also maybe helpful to point out that they played a particularly important role during the and still do during the period of COVID in relation to the management of distribution of PPE. So they were very busy through the period of COVID, but with a slightly different role. Again, that's something which we're in the process of working with the service to review the way forward to make sure that there's the right structure and support to the service to improve their performance. The average length of stays in care homes does fluctuate, and a small number of people can make a big impact on that figure. It will perhaps be more interesting to see information in the future rather than particularly comment on this one. The adult protection performance at Amber, Alison really covered in the report in more detail.
Yeah.
And the red reporting on sickness obviously touches into the COVID period, but again, it's maybe something that we would want to look at in more detail at the next quarter.
I think we've already agreed that last one's coming back with more detail.
Yeah.
But if there's any other points in the report, that's the only red one, all others being green and amber. It seems to be a standing red one, but I noticed we've got Colin down here. Colin?
Yes, thank you, convener. And as other long-term members of the committee will know, to be perfectly honest, the majority of the ambers and reds that we see on this report are generally things that we can't do anything about. And to be perfectly honest, in the major stream of things, I don't, and I have said this before, I don't care about the ambers on the ones we can't deal with. Just how things lie out. What I would like to say is, given that the Q4 results are at the very start of the COVID, I would like to thank the actual officers and staff for being able to still retain such high results for that Q4 in the majority for pretty much everything. So I'd like to start by saying that, and that the only one of these that we have that I've got a question with is 7.3. Now it's an amber, and the arrows are pointing.
Protection?
Yeah, the amber is an amber, and the arrows are pointing down the way. But it seems to me that the arrows. I know it's a standardised report, but the reality is, if I'm reading this right, it is an actual improvement. We've gone from. No, that's not. It's a decision within, not out with. So the arrows down is correct. Sorry, that was me misreading.
It's okay. It's easily done.
Because they have been written in the other direction at other times. So basically, in that case, since I've just realised my question was pointless, just to congratulate the officers for retaining such good standards in the Q4, and I think myself and the other councillors will understand why the absence rate went up in Q4 and why it was such a jump, given it was the start of COVID. Thank you.
And we'll see that next time round. Again, bearing in mind, as you say, that's the only red on the report, a problematic one at that. But sometimes we just gloss over and we only see negatives. There's one more flagging up here, and it's on page 70. If you look at the increase in re-ablement, which when we were audited was a negative area, if you look at the increase that we've surpassed the target, now up at 2,273. That is phenomenal, particularly when you consider everything else that's been dealt with. So it seems to be a day of congratulations. That's one I'd like to flag up, and I appreciate your comments again, Colin, in respect of the overall report. Can we agree, colleagues, to note the report then? And obviously, we've already spoken some of these areas earlier on, and we'll look for them the next time we get a report similar to this at the next committee. Agreed? Agreed to note, thank you. And it brings in some of the finances. Every cycle, or every committee is getting this report now. Annually there is a debt write-off. So I think I've got Thomas there to take us through what, thankfully, in our service committee is a relatively small matter, a small item in comparison with overall invoices. Thanks, Thomas.
Okay, thank you, convener. This is the annual bad debt report, which is prepared in accordance with the Council's financial regulations. The report highlights a total value of £13,310 has been written off under delegated powers, and the committee is recommended to write off a further £71,865. The main reason for debts being earmarked for write-off within the social work service is bereavement.
Can I agree, colleagues? Sorry, that's a relatively small, 53 million of invoices, and it's a figure of 85,000 that's to be written off. And being deaths, I don't think there's any point chasing them anymore. If that's not too less than subtle thing to say. And that is the nature of the invoices that have been sent out, is that there has been a passing of the individual involved. So if that's the case, can we agree to note that report?
Councillor Cameron's looking to come in.
Sorry, Colin.
Yeah, and I've got no problem with the report. I was just looking for a quick point of clarification to make sure I hadn't misread this, just because the amount is, it says it's 49 pence for two.
49 pence, yep.
For two small balances. I'm not misreading that. It isn't like one of these ones where a multiplier's at the end. No. That is 49p.
Yeah, 49p, but okay. You know what was me, Colin? It's two people.
Yes.
So it's 24.5 pennies from each.
Yes.
I think we can write that off.
Oh, yeah, absolutely. Unless you want to chip in, and I'll chip in and we'll pay it.
Okay, colleagues, can we agree to note that report? Takes us on to a more substantive financial report, revenue and capital monitoring. Thomas, if you could take us through this.
Thanks again, Convener. This is the Services Financial Monitoring Report as at 24th of July, which is accounting period 4. Before I give an overview of the report, there are two important changes to note in comparison to the equivalent information which was produced in previous financial years. Firstly, a combined revenue and capital report has been prepared as opposed to producing separate reports. This reflects the reduced number of capital activities which are being directly line managed by social work staff. The second change is that there is a new appendix highlighting social work net COVID costs, which is included as Appendix 5. Returning to the content of the report, in terms of the revenue position, the service is anticipating a full year overspend of £6.9 million. This total is aggregated from projected net COVID costs of £8.1 million, partially offset by an underspend in core budgets of £1.2 million. In terms of COVID costs, the main contributors are additional costs for external partners, for care homes and home care support, additional staff overtime, additional internal and external temporary staff, the purchase of PPE for staff, support for the NHS to reduce waiting times for hospital discharge, the expected underachievement of savings and loss of income. To help prepare the forecast COVID costs, the service has received government guidance and benchmarking data from other IJBs to help ensure that there is a measure of consistency around underlying cost and modelling assumptions. As a general point, however, there has been a nationwide reduction in forecast COVID costs when comparing the early submissions which were prepared in March through to the current time. This reduction reflects updated model assumptions, for example, in the number of staff who would be absent due to contracting COVID and the cost of recruiting additional staff. The forecast COVID costs will continue to be reviewed through to financial year end in light of actual costs incurred and updated Scottish Government guidance. To date, the Scottish Government has announced 2 tranches of £3.1 million COVID grant support for the Council, and which North Lanarkshire can access. The Council has received the first tranche of £3.1 million, and the second tranche is subject to the Scottish Government receiving confirmation of actual COVID costs incurred, and this verification and audit process is ongoing. The financial position in respect of additional COVID grant will similarly be updated in future monitoring reports. The service is anticipating an underspend within its core budgets of £1.2 million. There are 2 key reasons for this underspend. Firstly, in the period April through to June, there was a dampening of demand across frontline social work services in areas such as new SDS, care home placements and home care approvals. Secondly, given the serious financial pressures resulting from COVID, all council services are operating within an environment of only incurring essential expenditure within their core budgets. Turning to capital expenditure, the majority of the service resource is dedicated to activity within the joint equipment store. The report highlights a break-even position at this stage, although I can advise there is an exercise ongoing to establish if in-year installation delays due to COVID can be fully caught up between now and March 2021. The outcome of this exercise will also be incorporated into future reports. I'm happy to take any questions.
Thanks very much, Thomas. Highlighting salient points here. I see one person wanting. What I would say is, this will vary, as Thomas outlined there, as Scottish Government allocates further funding. But the bottom line of COVID financially for the social care, adult health and social care is seen there. We were heading for a 1.2 million underspend without COVID. It's there in the revenue at 2.4, and you see the situation we're in. So Based on that, bearing in mind that this will appear finance committees and policy resources, if there's anything that needs analysis at this particular stage, just hit the button. And I noticed that Councillor Bartley has already done so. Claire, thank you.
Thanks, Kavina. I do not have a question on this. What I do as a comment is not only are we praising staff and frontline staff and officers who are dealing with the services, but I think we really need to put on record our thanks to the financial people. And Thomas, yourself, and Elaine Kemp, and everybody within that team. I honestly don't know how your brains haven't quite exploded. And I think that there'll be an added cost in the number of batteries that are needed in your calculators, because this is a horrific situation for everybody. But to try and keep a handle on the money and the costs when it's a change day by day, fluid situation, where the Scottish Government don't know what money's coming from Westminster, because there's a fluid situation there. Then when the money's come to the Scottish Government, what's coming to the council, and then what department is needing the most because it's of the whole situation. So there's no question in this. It's basically to say thank you, and thank you, Thomas, and for the staff that are going about with cool pads to make sure that their calculators don't overheat. Thank you.
Thanks, Claire. That comment reflects what I'm glad people have adopted as an approach that is pointless having a political bun fight through all this. We've got enough problems to deal with. As we certainly have never apportioned any political blame at one another in this. We know we've got our political labels, but we're more important, and more importantly in dealing with the task at hand. And you're right, the backroom staff need as much recognition as everybody else. That I'll make clear in the statement that's going to be made on your behalf. The committee, that is. So if there's no further questions on that, and concurring with Claire's comments, no doubt, can we agree to note both the capital, which is a smaller report there, but we'll put capital and revenue together and move to the last item, which, with your permission, Thomas, can you merely just formally ask to give approval, and it's here for, I think, homologation anyway? Is it Thomas that's moving this? No?
Convener, this is just a standard report that goes to all committees, just outlining contracts that lie outside the financial thresholds for reporting to committee.
So it's merely here for homologation. Can we agree to note that report then and the contents therein? It's obviously an important service. It's the one of the volunteering matters, one of the services we mentioned earlier that brings so much to the overall problems that we've addressed. Can I thank
Convener,
you?
sorry, Councillor Baird is looking to come in, I think.
Councillor Baird, Davy, sorry.
I take it this is the item on the contract.
The contract, yes.
Contract. Just a few questions, if you don't mind. I'll try to be concise on it.
No problem.
It's just to see, you know, the nature of the contract. Was it a rollover contract, or was it a new contract? And there's very little in the actual report. Who is it we're befriending? Is it all you know, is it all categories of the clientele that we're looking at? Is there a methodology as to, you know, the method used? Was it just the mechanism? Was it a balanced quality mechanism? Or was it just basically on pricing, or was it just a set contract value?
Right. Well, what I do notice on page 96 is that the N means negotiated contract. Now, I don't know what that means, and we'll get clarity from the Andrew. If you could clarify, if we could contact the committee, agreed to have clarity on the process used to agree the contract. Can we get that from Graham? Can we get Graham Proudfoot to clarify that? And also the befriending. Alison, am I right in saying that ties in with some of the services that we mentioned?
Yeah, so I suppose I can answer some of the questions, but you may want further clarity. So the contract relates to befriending for young people principally. The reason it's here is to do with some of this, the continuing joint arrangements that we have in terms of our quality assurance and commissioning that cut across both adult and children's services. So social work is still supported by the same quality assurance and commissioning team, whether it's for adults or for children and families. Volunteering Matters are a provider who we had an existing contract with, and the contract has been extended for a period of time to allow for further consideration of what the longer term needs are and consideration of the appropriate tendering approach. The reason why it has been extended for the period and it's gone through that particular procurement process is because of the nature of the provision and the provider and the need to provide continuity to the particular group of young people who are supported. It was agreed with our procurement colleagues that that was the appropriate mechanism to extend the contract, pending us revisiting that fully at the within the year.
Davy, quite a bit of information there. The nature of the service.
No, it certainly does answer a lot of questions which were missing. It didn't seem to say where or why the contract was coming into being, and that's why I was asking, was it a rollover?
Oh, absolutely.
But
I mean, I ask questions in these things all the time, so you're right enough to ask.
So no, I'm quite happy that you know it's just extended until later in the year when a report will be made and a full sort of, I take it will be a full tendering process will take place to go back out.
Well, there's other conveners I can see on screen, and I dare say that they're getting contracts continued because of the nature of COVID. That sometimes has to be done. I noticed that Housing Tomorrow, which I'm going home to read, has some contracts that have been continued for that. So we've got that logistical difficulty, notwithstanding the fact that some contracts are already been awarded. So there's ongoing COVID, but those issues, the nature of the contract that Alison's outlined, if you're okay with that, I can move.
And given the context, convener, it's likely if there is a change proposal that will come back through Education and Families Committee actually, rather than Health and Social Care, given the nature of the contract. This is a sort of legacy issue about our joint arrangements and the way our quality assurance and commissioning team are working, that it's reported, because this would have been the committee that approved the original contract.
So what you're saying is it's Frank McNally to blame us?
It will come back, yes.
Davy, you okay with that?
Thank you.
Thank you. Colleagues, won't delay you any longer.
Convener, sorry, Councillor Damasio is looking to come in.
Councillor Damasio, Paul.
Hi folks, just a quick point, a general point in relation to these reports for contracts awarded. I've raised this issue before. You know, I think we should have a bit more detail within them. Then you're to be fair to yourself, Chair, you're likely to get less questions if they're provided with a bit more information within the paper itself. There's very little information in there, just to point that out. And that's a general issue.
Certainly, you know, Paul, I'm of the opinion that we're the custodians of the public purse. We've got to ask questions. So if we feel that there is a paucity of information, it's incumbent upon us to ask those questions. But we're not going to solve that, you know, at the social work, adult health and social care. So I think that should go through the channels of us writing to the administration and saying, when it comes to reporting and contracts, more information should be given when contracts are being awarded. So it's something that we should take up possibly with our own groups, as well as individual councillors with the relevant officers.
I'm glad you're in agreement. Yep, I shall do it.
Thanks, Paul, and thanks, folks. I won't delay you any longer. I really appreciate all the input, and I think in view of the ongoing circumstances in our communities, it's only been right that we give this time and attention to the reports that we had in front of us. Very much appreciated. Stay safe, and I'll see you hopefully in person in the not too distant future. Thank you.
Vote thanks to the chair.
Thanks to the chair.